Thank you. Good morning. Recognizing a quorum, I'm calling this meeting of the Cannabis Control Commission to order at 10 a.m. on October 14th, 2021. This meeting is being recorded. I want to thank Matt Giancola, as always, for his help in preparing for this meeting and conducting it. Before I go through the agenda, I'd like to make a brief comment and then ask my fellow commissioners if they'd like to make opening comments as well. As you know, we have been asking the legislature for help to both clarify some ambiguities in the legislation, as well as to consider extending our authority to help us meet our legislatively stated mandates, particularly with respect to equity and inclusion in the industry. I'd like to acknowledge and thank co-chairs Donahue and Chang Diaz and all of the members of the Joint Committee for taking up several matters, including a social equity fund, host community agreements, as well as social consumption. And we appreciate their effort. We stand by, willing to help in any way we can. Let me ask other commissioners if they'd like to make opening comments, and then we'll get into the agenda. Let me start with Commissioner Camargo.
Thank you, Chairman. Absolutely. So a few things. I just want to say, obviously, good morning and buenos dias. I want to thank our staff, and I know we do it every month. Our last CCC meeting was about maybe 3 weeks ago. I think we're about to hit our fourth week, maybe this week. But so much goes into preparing for these meetings, and I know we've done so much legal work in the last 3 weeks. So I just want to thank you for putting in overtime, because I know you all have done that this the past 2-3 weeks. So thank you. And I just want to say, in respect to my heritage as a Latina, it is National Hispanic Heritage Month, which actually finishes tomorrow. And it's about a month long, but I just want to say, happy Hispanic Heritage Month to all our Latino staff and other folks who identify as Latino. And even if you're not Latino, you could still celebrate it. It's a great culture. So thank you.
Thank you very much, Commissioner. Commissioner Concepcion.
So I have a few comments. I'll keep it short and sweet. First, just to echo you, Chairman, on the legislative front. I just wanted to say, although we as a commission have agreed to a legislative agenda, the legislature should not interpret this as a signal not to move forward with any necessary legislative action. On another note, I wanted to thank Sergeant Decker, who's the director of the Massachusetts Drug Recognition Expert Program, who welcomed myself and several staff to the September training on cannabis DRE training. It was really informative. I look forward to doing this frequently, having some more communication about some of the practices that law enforcement uses around cannabis. And lastly, I wanted to say thank you to Nicole Snow and the members of the Public Health Subcommittee. I was able to join their meeting last month. It was really informative, and I know that there are ongoing conversations that I look forward to having. So I just wanted to say thank you to those members as well.
Thank you, Commissioner. Commissioner Roy.
Thank you, Mr. Chairman. Good morning, everyone. I just want to take this time to thank the Massachusetts Sheriff's Association and all the sheriffs in the Commonwealth for allowing the commission to come forward yesterday at their meeting. We had a beautiful presentation and to discuss an overview of the commission, as well as opportunities for partnerships with the sheriffs in collaboration when it comes to reentry, employment opportunities in the cannabis industry, and recidivism reduction. I also want to thank Chief GB and his team. They did a remarkable job with their presentation, as well as Cedric Sinclair and Kevin Sibley for their work and hard effort to have a on-point, impactful presentation for the sheriffs. And I want them to know that the feedback has been tremendous. And again, I want to thank them for that opportunity yesterday. I also want to thank Dr. Julie Johnson, the head of research at the commission, and her team for the hard work in today's, what we will discuss today's research study. And also for her guidance. She's been a tremendous resource for me personally when it comes to public health issues as it relates to cannabis. So thank you very much, Mr. Chairman.
Thank you, Commissioner. Commissioner Stebbins.
Thank you, Mr. Chair. I'll keep it brief, just to express my thanks to the staff as well, our CFO and Director of Research for making time available because they have some pretty big reports at today's commission meeting. I thank them for making time to kind of give myself and other commissioners sneak previews in advance of the meeting. So I thank them for their help.
Okay, thank you. Let's move on to the agenda. Matt, if you could put the next slide up, please. We are done with chairman's comments and updates, so we will go through minutes for approval. We have one set of minutes from our last meeting, September 17th. We have the high point of the meeting, the executive director's report. This will be a lengthier one than usual, as aside from the normal statistics that and updates that Sean will go through. We're going to provide, I think, some pretty interesting perspective on the applications and the outreach process for the third cohort of the social equity program, as well as closing down the books for fiscal year 21, which ended, I guess, June 30th of this year. So looking forward to that. We have, I think, 5 changes of ownership, standard amounts of renewals, final licenses. I think we have 17 provisional licenses to go through. And then we have 5 topics for commission discussion and vote. The aforementioned report on potency by our research department headed by Dr. Julie Johnson. We have a job posting, a new position. We have the first set of renewals for our responsible vendor training vendors. We have the annual activity report that we're required to submit to the legislature every year that needs our discussion and approval before it gets submitted to the legislature. And then, as you all will recall, last month we started a conversation about additional disproportionately impacted communities, specifically Lawrence. We agreed at our meeting last month to table it for a month, but it is back on the agenda for discussion and if appropriate, a vote this month. So that's it. Let me get started by going on the first agenda item, which is minutes for approval. Can I ask my fellow commissioners, have you had an opportunity to review the minutes from our meeting on September 17th, 2021? And do you have any questions or comments before I ask for a motion and a vote? Okay, then could I ask Commissioner Stebbins, would you make a motion, please, to approve the minutes from our meeting on September 17th, 2021?
So moved.
Thank you. Commissioner Roy, would you second that motion, please?
Second.
Thank you. Let the record show that Commissioner Stebbins made the motion to approve, seconded by Commissioner Roy. Commissioner Camargo, your vote, please.
Aye.
Thank you. Commissioner Concepcion.
Aye.
Thank you. Commissioner Roy.
Aye.
Thank you. Commissioner Stebbins.
Aye.
Thank you. Commissioner Hoffman, aye. Let the record show that the commission approved the minutes from our meeting on September 17th, 2021 by a vote of 5 in favor. Commissioners Camargo, Concepcion, Roy, Stebbins, and Hoffman with none opposed. Thank you very much. And again, as always, thank you, Christopher Smith, for doing the great job that you do, keeping us up to date and accurate with our minutes. Really appreciate it. Mr. Executive Director, are you ready for your report?
I am.
Then please go ahead, and thank you very much for joining us.
Thank you for having me. Good morning, Mr. Chairman, Commissioners. I'll go through first the normal licensing data and the highlights from our licensing portal, and then of course we'll dive deeper into some sections of that information. So you'll see here that there are 4 applications that are currently awaiting their first initial review. You have 17 applications before you for your consideration today. There are 32 applications that, after having been reviewed and the commission staff having issued a request for additional information, are now resubmitted to us for our consideration and therefore awaiting a supplemental review. As of today, there are 97,158 certified active patients with our medical use of marijuana program. And lastly, there are 687 total applications for Cohort 3 of the social equity program. And just like last month, I'll present a further breakdown of those applications based on race, demographic, and other relevant information. So a lot of activity in that portal, and our staff is managing it on a day-to-day basis and doing a good job of it at that. So you see here, this is a very high level 30,000 foot look at our licensing portal as far as total activity. The vast majority, 7,016, remain incomplete or have not yet been submitted in their entirety to us for the staff's consideration and ultimately with an attempt to get to you and your meetings. There are 226 that are pending, 987 that have been withdrawn, and to date there have been 928 that have been approved, as well as 3 delivery endorsements and 118 pre-certifications. A breakdown here based on those 928 approvals as to where they stand as far as which license type. 373 are that of a marijuana retailer, 281 are marijuana cultivator, 214 are product manufacturer. That does comprise the traditional supply chain, as well as 14 independent testing labs that are a critical component of that supply chain, ensuring product safety to ensure public health. Again, I'm happy to take any questions on this slide as well.
Commissioner Camargo, do you have your hand up? Okay, sorry, Commissioner Roy, please.
If we could go back a slide, thank you. If you could just share, I know you briefly touched upon it last time, Mr. Executive Director, about the increase in independent testing laboratories and the positive impact that does have on not only quality control testing, but also the supply chain, if you will.
Sure, that's a great question. So historically we've had we've always needed and wanted to secure additional labs in our supply chain. Having 14 licenses having been approved, in a later slide will show that kind of pizza tracker slide will indicate where they are in the licensing stage. Obviously, the more labs we have, the more work it is for our staff to continue to oversee them. They are licensees of the agency, so we do have a responsibility to ensure compliance amongst the labs, but it does also allow that supply chain to have a wider array of opportunities and options to move supply through to get it ultimately to a retail storefront. So more hopefully brings in a larger volume, larger capacity, may also have an implication as far as testing and getting, pricing of testing, and getting that as a more competitive environment as well. So obviously I think having more independent testing labs is a benefit add to the supply chain, but it does create a bit more work for us to ensure that we are able to continue to ensure compliance amongst those labs as they are in fact for-profit but independent testing labs. So that's also why, and thank you for your approval last month, we continue to build out that staff as well with the new role of Director of Testing.
Thank you.
Any other questions for the Executive Director at this time? Okay, then please keep going, please.
Sure, advancing through here, this is a breakdown of those approvals, where they stand in the licensing stages themselves. As I mentioned earlier, there's pre-certifications and delivery micro business endorsements. So pre-certifications at this point are both marijuana courier as well as marijuana delivery operator. There's 120 total there. We do have 100 that have been provisionally approved, as well as 464 provisional licenses. The difference there is that provisionally approved means the commission, you have considered it and approved it, but the entity has not yet paid their license fee. And the provisional license is actually in fact issued once the license fee is in fact paid. A final license has also advanced to you for your consideration after an inspection from the commission, and 300 entities have commenced their operations and begun to operate here in the Commonwealth. This slide here does reflect some of our workflow. As I mentioned at the outset, there's 4 applications that are awaiting their initial review. We've reopened and therefore reviewed 174 applications and asked them to provide us additional information, which could be an array of requirements, missing documentation, clarification necessary, updated positive impact plans, diversity plans. Again, there's a myriad of issues as to why we would reopen an application. There are 31 entities that we are awaiting a third-party response from. That third-party response could be a municipal response, confirming that the entity is compliant with local zoning and bylaws. It may also be the third-party background check that's necessary on the entity as well as the individuals that own or control that business. You have 17 applications before you today for your consideration, and as I indicated earlier, between the delivery pre-certifications as well as actual approval by the commission, there's been a total of 1,053 entities that have been considered by the commission.
Sean, if I could ask you, on the third-party responses, specifically as it relates to background checks,
yes.
Are we seeing any slowdown from our vendors during the pandemic, or recently? Has there been any change to the turnaround and responsiveness from those organizations?
Sure. Thank you for the question. It's actually, so we did certainly at the height of the pandemic, without a doubt. It was primarily the access to information. If information was necessary from other jurisdictions, depending on their status as either remote or in person, in obtaining records that might be necessary. As of late, I wouldn't describe it as any change necessarily. It's something we continue to monitor, though. A change that has been helpful, I think, is especially during the pandemic as well. Background checks had to do manual fingerprints. You had to come to Massachusetts to have your fingerprints taken. Through a change at the Executive Office of Public Safety and Security, as well as to CGIS, we are now able to they're able to mail cards to folks wherever they may live, and they can get their fingerprints taken at, say, their local police department. That has expedited that process, as well as made it, I think, safer as far as travel is concerned. And so I've noticed the change there is able to turn those fingerprints around a little bit faster. We obviously continue to monitor it though, and what we've noticed, of course, is with the addition of more staff, we're able to get through more applications more quickly. So we might be causing a bit of a bottleneck ourselves with moving applications out quickly, but not with a noticeable change that I'd be worried about at this point.
Okay, thank you very much. Other questions before we move on? Go ahead, please.
This next slide here is a breakdown based on an applicant's status. That might be a priority applicant, which is a combination of existing medical use of marijuana program, marijuana treatment center priority applicant, or an economic empowerment applicant. The next phase is expedited review. Expedited review can be granted based on license type, your status as a social equity program participant, your status as a disadvantaged business enterprise as maintained by the Supplier Diversity Office, or in some cases more than 2 or more of those categories. And lastly, if you don't qualify for priority or expedited review, we will get to your application as a general applicant. And as you can see, having 4 applications that require their initial review, it doesn't take us long to get to that queue as well. You see here that 92 entities have secured and used their economic empowerment priority status, and 400 entities have used that expedited review, which is that policy choice made by the Commission not that long ago. The majority of them, actually a good balance here, are social equity program participants or DBE, which is women, minority, or veteran-owned businesses.
Questions? Okay, please keep going.
This slide here is, again, we've talked about in the past as far as wanting folks to advance downward in the table. In other words, getting from that pre-certification phase all the way to the commence operations and tracking that historically over time. You'll see that there's a, I don't think that should be plus 11%. I think it's plus 1% of 36.7% of our total applications qualify, excuse me, as an economic empowerment applicant, a social equity program participant, or that DBE status. The numbers you'll see on the bottom there of 8, 9, 26, and 43 do represent progress. Certainly month over month, we'll continue to look for that gradual update, but I found this slide to be very helpful in monitoring our progress toward achieving that goal of getting communities and individuals that have been disproportionately impacted into the industry. And again, I don't think any of us would argue that we're satisfied with this number, but we do want to continue to see that progress month over month.
Thank you. Please keep going. You call this pizza slide. I, from my history, would refer to this as a Mary Mecco slide, but it's a good slide, whatever we call it. So.
This is an important slide. I do try to bring some life to it with some green highlights here to just call your attention to certain elements that I want to make sure we're able to see, again, progress month over month, but also to look ahead to see what our workload and bandwidth might require. So as I noted earlier, and Commissioner Roy, your question as to independent testing labs, having those applications, I think, is obviously a positive thing. What's an important trend for me is seeing that 7 entities have commenced their operations. For a number of months, or actually a number of years perhaps, it was 2 to 3. And so seeing that growth in the last 6 months or so does indicate a good opportunity within the industry of getting those new labs into the marketplace and ensuring that they're able to serve that growing number of cultivators as well as product manufacturers that are pushing product and pushing inventory into the marketplace and hopefully getting it to those marijuana retailers. So,
John, if I could interrupt, I'm sorry. On the testing laboratories, the 7 that are open, do you have a sense of geographic dispersion? I mean, are they across the state or are they concentrated in parts of the state? Do you know?
I'm not seeing a concentration. What I'm seeing is I think some are essentially, I think most are centrally located within the Commonwealth. There's also, I guess not surprisingly, activity in Western Massachusetts as well. Which is always encouraging for us to see, but that geographic information is certainly something that we should look at and see if there's obviously either a trend or a need in any particular geographic region, or does it support the location of existing licensees to make sure that transport is not a logistics challenge.
Okay, thank you.
course. Other information I just want to call your attention to is I point out month to month that we have 58 open marijuana cultivators, but 160 provisional licenses. These are generally large, expensive operations to build out. And so moving folks from that provisional license phase to a final license phase may take some time. Similar, but a little bit different logistics as far as product manufacturer. Depending on the scope and size of that product manufacturer, it could be a small commercial kitchen or it could be a large scale manufacturer. We have 117 provisional licenses and 52 that are open. And marijuana retailers continues to be a vast majority of our licenses. And you see that it's also the vast majority of open establishments. So other items for your consideration would be the marijuana courier licenses. We now have 4 operating here in the Commonwealth. We also have 73 that are pre-certified here, as well as a delivery operator. We have 45 that have been pre-certified and are going to begin to make their way through the licensing application process.
Commissioner Roy?
Mr. Executive Director, on the marijuana cultivators, is it possible that we could have a future report to see how many fall into what tier, what size canopy, if you will? And you know, I'm assuming the majority are indoor grow, but if there's any outdoor grow, I'd be curious to just see the majority of where the canopies are, is, you know, as far as tiers.
I can satisfy one of those questions with the very next slide. What I will do in the next meeting is bring the tier breakdown as well. But we did, thank you. Yeah, we did break it down based on indoor versus outdoor, based on a request at the last meeting. So I guess, Matt, if you could advance to the next slide. So this is a breakdown based on indoor versus outdoor. You'll see the majority, 299, are indoor cultivators. I was actually admittedly surprised by the 46 outdoor cultivators, just given our climate. This is New England, this is Massachusetts. And there is a concentration here, it seems, at least based out in Western Massachusetts. But having that 46 number, 8 have commenced their operations. Several others are in the pipeline. There's just a growing season and a climate that needs to be conducive to it. But again, this is, I think, an encouraging sign to see that the Commission's priority to get farmers into this space, as well as to prioritize outdoor grows, expedite their review, is paying off and getting folks through this licensing process. But this will be a stagnant slide that we continue to update month to month.
Thanks. Oh, go ahead, Commissioner Camargo.
Yeah, Mr. Executive Director, good morning again. The slide before that, and I don't know if I missed it, so I apologize, but the first marijuana cooperative, can you shed some light on that in terms of why it's so low? Is it an industry thing? Is it a process?
As far as just the volume on cooperatives?
Yeah.
It's this is purely, it might be anecdotal, it might just be my best guess scenario. It's a complicated business structure and requires a number of folks to pull together. And so the idea certainly, I think, is well intended. And so we'll certainly look for any feedback that folks might have about what perhaps makes it challenging. But you do have to meet those cooperative principles. And I believe someone may have to file a Schedule F. Similarly, it requires Massachusetts residency. So again, those are just complications that folks need to navigate through. So they may be choosing the path of least resistance, which would be to apply for a straight courier cultivation license. So, but certainly worth exploring, and we'd be happy to dig in a little further. Again, that's my either anecdotal or best guess based on whatever information I may have.
No, I appreciate that, and sorry for just kind of bringing it up, but it just hit me. So thank you so much for that background.
Sure, it's a great question though.
Other questions? Please keep going, Mr. Executive Director.
This next slide is a bit of insight into our medical program. You'll see here that we have 44 provisional licenses. We have a total of 179 licenses altogether, and 86 of those entities have commenced their operations. On the right-hand side, you see there's 103,000 certified patients, 97,158 certified active patients. The difference there is that patients may be certified by their provider, but may not have yet finished their certification by registering with our program through our portal. There's 285 certifying physicians, 98 certifying nurse practitioners, which does imply that there remain 0 certifying physician assistants. This is a new slide, and I wanted to just call your attention to it based on the activity that we've seen year over year, as well as the activity that our staff continues to work through from a workload standpoint. So as you know, changes of ownership, changes of location, changes of name, and tier changes are all allowable adjustments that a licensee may make. It does bring a level of workload to the commission, of course. Some have been delegated to staff, others remain a commission vote. For instance, changes of ownership is a bit of a threshold question. Adding an individual below the 10%, but perhaps control might spike up, or adding additional elements of ownership to a person who may be acquiring shares, for instance, that's already been approved by the commission, may be an administrative action. However, a wholesale change, a complete merger or acquisition is going to still come before the commission. Changes of location, as you can see, remain pretty stagnant year over year. Changes of name continue to uptick based on, I think, just the pure volume of licenses as folks get closer to starting. And tier changes is something I suspect we're going to start to see more frequently as folks begin to develop that 6 month of sales data out of their cultivation. So what I wanted you to see, of course, is this is something we are able to track. And it does help us, me, Kyle, Yao, ensure that we're staffing adequately these applications. Changes of ownership, I would argue, are, and sometimes they're pretty straightforward. Other times, as you can see, and as you've reviewed on your own behalf, they get very complex. And so that might require a handoff between our licensing staff and our investigation staff. It might also take us some time as the complexity gets more and more intricate. It might also include having to get records out of Canada, for instance, and following some of those activities at the Securities Exchange Commission, given their federal legality. So always, again, it's complicated, but it's something we're able to track and something that we do have to resource appropriately here at the agency. So this is I found this to be very useful data and wanted to share with you as a result.
Go ahead, Commissioner Roy.
Thank you, Mr. Chairman. Mr. Executive Director, as we see more of this, changes of ownership, outside entities coming in from outside the Commonwealth, has this resulted in a change of equity status on any of these existing licensees?
To my knowledge, no, not yet. That is actually, that's a great question. It's something we do have to track. So for instance, if an economic empowerment applicant were to come in and propose a change of ownership, we review as if it were a new application for economic empowerment status to ensure that they may maintain that status. It would not prohibit the change of ownership going forward. What it would do is it could mean you might sacrifice that status as an economic empowerment applicant. Losing that, of course, means you lose the benefits that go along with it, including fee waivers, fee reductions, metric fee payments, and the like. But it is something that our staff would have to review and ensure you're either still eligible for that status, or if you are no longer eligible for that status, that we notify you of that. Again, it wouldn't prevent a change of ownership. It just requires another layer of work for us.
Well, my concern is, so for exclusivity with the delivery licenses, if one of them were to be acquired, how does that work?
That would implicate the change of ownership where it would not be allowed within that 3-year period.
Okay, thank you.
Go ahead, Commissioner Stebbins.
Thank you, Mr. Chair. Mr. Executive Director, the changes of location, and again, you might just be able to offer your best industry guess or even some anecdotal reply to this, but the changes of location, are those, it's a pretty capital intensive process and a laborious process to site your facility, go through a HCA process. Do we think these are folks that are moving within one community, or are they moving out of a community altogether into bigger space, or what do you see as most of the reasons for this?
It's a combination of factors. Some are moving unit A to unit B, and that would be considered a change of location. That rationale might be just a bigger space. That's I think actually a very, I wouldn't call it frequent, but that's an example we've seen. Others are, I have a provisional license in one community, I'm going 2 towns over, but I've not yet built out any of my facility so the capital investment has not been as intensive. Others have changed their location based on, it might be a medical application that's moving the dispensary affiliated with a grow in product manufacturing into another community. for any number of reasons. So it's, I would say folks have a lot of different reasons for changing locations. Some are very administrative. My complex was bought and the numbers were renumbered. And so that would constitute a change of location for us as far as the logistics. They're relatively easy for us. A few things we do require, though, and I think this is important to note, is that the existence of an HCA be confirmed and verified. We also reissue that municipal notice to ensure that they are in fact compliant with local zoning and bylaws. And we essentially process that as a new application as far as that location is concerned, to ensure that no community, no resident would be surprised by the existence of an establishment that wasn't there a short while ago.
Yeah,
Okay.
I apologize in advance, Mr. Executive Director, for this question. It's my opinion that the increase we're seeing in changes of ownership is going to continue. So I think this is going to be increasingly not a burden, but it's going to increase the demand on resources from the commission. I know that they're all different. Some are simple, some are complex, so there's no kind of average, if you will. But do you see any trend line in terms of how long it takes us to get to these and to process these, given the increased volume that we've seen over the last little while?
I do and I don't. I don't think there's a clear figure I could give you at this point that would not be, first, would not be a guess, but secondly, I think would not be uniform, or even, I would say the bookends of our time spectrum are really going to be dramatic, simply because some changes of ownership are incredibly complex and require the devotion of investigative staff, as well as you do know and hopefully recall, we have that external vendor that we use for financial implications. So the devotion of resources there is something that we take seriously. Others are simple background checks on individuals that might be coming into a management role. Adding a new CFO, adding a new CEO even may require just a background check on an individual. Adding new board members. Those we're able to get through the normal course and don't take us much time. It could be a month-to-month turnaround just based on the timing of background checks and fingerprints. Some admittedly sprawl into the months range. I've always found applicants to be cooperative. I think it makes sense. They have an interest in getting this across the finish line as well. But it does require an intensive investigation on our staff's part, as well as involving a third-party vendor to help us. Two changes I think we've made that are allowing us to meet this demand is we've added investigators and we've added licensing specialists. I would say from an application review, a substantive review standpoint, we get through these within I would say several weeks time as far as the initial review. It then gets assigned out if necessary to an investigator. So that's where that time is going to be spent. So, but again, I would hate to give even a guesstimate at this point because it would be exactly that. But and also the complexity is just such a vast range.
Right. Okay. Well, thank you. That's very helpful. Appreciate it. Other questions before we move on? Please go ahead then, Mr. Executive Director.
That concludes the data portion of the my traditional slides. I wanted to give you also just a few other updates that I think are relevant for your consideration, as well as through you to the public where necessary. At your last meeting, you did approve the reissuance of telehealth waivers for that initial certification for patients. There's some information I want to bring to your attention. One is that to date, we've received 26 waiver requests. We've approved 23. That might have actually been updated recently, as recently as yesterday. It's not to imply that those other 3 have been denied or disapproved. They're still pending. So we'll get through those, I think, before the week is out. That said, there are 384 total certified providers. And so there's discrepancy in numbers that I just wanted to call your attention to, but also let those providers know that if you are still offering telehealth certifications for that initial certification, you must secure a waiver in order to do so. Otherwise, failure to do so would be non-compliant with the regulations. So a gentle reminder and a gentle nudge to those providers that if you are offering initial certifications through the use of telehealth, please do secure a waiver. And also we'll be looking into this with our staff. And obviously, if there's any outreach that's necessary from us, we'll conduct that again to get folks into compliance here if they may not be. So that's not me assuming anything. It's me just providing folks an update and again, providing that gentle nudge. Next update here is that you may recall that we recently produced our regulations and some guidance documents and translated them into Spanish and posted them on our website to bring some ease of accessibility. Again, our official regulations are those that are in English, but this is hopefully helpful for folks to navigate our process. We've most recently updated those materials and provided them in Portuguese, the second most common language spoken in Massachusetts. I'm sorry, the third, English, Spanish, and then Portuguese. So that's another attempt for us to bring our regulations and some of our other information and make it accessible to folks that English may not be their first language. Again, the English version is still the official version of it, but hopefully folks can access and utilize those materials to their benefit.
Commissioner Roy.
I'd just like to thank the commission for their efforts in translating these into documents into Portuguese. Full disclosure, Portuguese descent myself. I appreciate that, and I know this will be a great help and benefit to the Portuguese community, folks who want to enter into the cannabis space. So thank you very much.
So here we go. So this next slide, as the commission knows, the Department of Agricultural Resources, the regulator for the hemp program, recently updated their policies on October 4th. It does implicate our licensees, so I wanted to call your attention to it, as well as just provide the public an update as well. It does allow the sale of raw hemp products and processed but not final hemp products to marijuana establishments. So it does, again, implicate our licensees. If our establishments would like to manufacture products using hemp as an ingredient, so infusing CBD oil into what would be a marijuana product, MDAR's made it clear that you would likely not require a license from MDAR. The reason I say may not is because they make it clear that it cannot be advertised as a hemp product if you were to do that. If you do advertise it as a hemp product, of course, that would require licensure from MDAR as the regulator for hemp. So if you want to infuse it into a marijuana product, you would not require a license from MDAR. I indicate here that further guidance may be necessary. I think that's true, just given that we want to make sure our licensees are operating in full compliance with our regulations and our statutes. Also, final note here is that final hemp products may still be sold directly to marijuana retailers, which does now include hemp flower, which prior to this updated policy was strictly prohibited. We do have existing guidance on the retail sale of hemp that still exists, it still applies, and so folks, especially our licensees, should be cognizant of that and mindful of it when engaging in a wholesale relationship with these hemp farmers that may be producing products for sale in their facilities. And lastly, here is we continue to assess these implications, and obviously if something is necessary, be it an update or a new guidance document, would bring it to the commission with a sense of urgency, of course, that knowing that hemp farmers are in their harvest season right now, we want to be responsive to that. And our licensees are interested in collaborating with hemp farmers. And I think this is a good Massachusetts connection that we want to facilitate where possible.
So, Mr. Executive Director, I know that you and our General Counsel have been working hard on this in collaboration with MDAR. I wanted to thank both of you and others that have been involved in those conversations, as well as MDAR. And I think we're starting to get to a good outcome here. So I appreciate the effort necessary to get there, although I know there's a little bit more work to do. But I think we're making good progress, and thank you, and thank General Counsel Bailey for your roles in that. Go ahead, Commissioner Concepcion.
Thank you. Mr. Executive Director, I'm only asking for a direct, more explicit statement. So in order for MDAR flower, hemp flower is now permitted. But in order for a hemp flower to be sold, that does in fact need an MDAR license, correct?
In order for hemp flower to be sold, let me answer your question with a question. In order for hemp flower to be sold by our retailers,
yes,
would require that the hemp flower be produced by a hemp farmer licensed by MDAR. In order for our licensees to wholesale that flower in and sell it as a retail product, would not require our licensees to have an MDAR license.
Right. Okay.
Any other questions?
That does answer it. We're saying that in order for it to be sold, it must be sold by someone who has an MDAR license. to our retailers.
That's correct. Yes, absolutely. Yep.
Thank you.
Any other questions on this topic? Please keep going, Mr. Executive Director.
Sure, thank you. And obviously, to your point, Mr. Chairman, our thanks to MDAR. They've been a valuable partner in this, and we know that they share our priority of again, facilitating that relationship where possible. So certainly look forward to future conversations and work with them as well. Pivoting now to the social equity program, as I noted at the outset of my presentation, we have received 687 applications for Cohort 3. As you will recall, our last meeting, I announced that the deadline has been extended, until November 15th. We do hope that we can continue to identify outreach opportunities, additional outreach opportunities where they may exist, and that we are based in not only on geography, but demographics as well. We continue to review these applications on a rolling basis. We're not waiting until the end and then digging into them. So folks are getting updates from us on a periodic basis. That does include information that might be necessary to be resubmitted or clarified, or we're not rejecting applications as much as we are reopening them during this window. So we encourage anyone that might, if you think you're eligible, please do apply. Please begin the application process as soon as possible to ensure that you can compile all the information that's requested. And again, as we consider them on a rolling basis, once you are accepted, benefits, including access to the exclusive license types, those do accrue immediately, as well as access to some of the existing coursework that might be available as a baseline introduction as well. So we want to get folks into this process and get them working as we continue to consider applications on that rolling basis up until and probably after the 15th as far as the review is concerned. So just a general update on the social equity program with the next few slides, digging in further to the 687 applications.
Commissioner Camargo.
Yeah, I just really quick, and I know that Mr. Executive Director, you're gonna kind of talk a little bit more about the program itself and where we're at, but I wanted to just take the opportunity to echo the chairman's comments in his opening remarks. And I think, Chairman, you've been on the commission now longer than all of us, and I know you've been championing. I know you feel it. I know you feel it. I know you've been one of the champions for social equity and the social equity program and the host community agreement bill and the social equity fund that, we're hoping that legislators, create. So I just wanted to echo that, because the more we see these numbers go up in terms of our social equity program, the more cohorts that we're preparing, the more support that we're going to need for social equity applicants. And I think that there's a lot of work being done on the ground. And I hope that the legislators, we can't tell you what to do, right? But we will ask and try to be supportive in terms of helping the legislators, figure out when does this social equity fund get created at the State House. And I think that, we, like you said, Chairman, we'll talk about it, more next month. But, I just want to thank also our legislators for being so collaborative right now and just looking at these processes, especially the host community agreement and the social equity fund. So just wanted to say that before we go into the next slides.
Thank you. And I do think it's true that I have actually served longer than the sum of the 4 of your tenure. I don't know if that means anything, but I think that's mathematically correct.
That means you've gotten beat up a lot.
I used to be much taller and had much more hair, but it's all been worth it. Go ahead, Mr. Executive Director.
Or you beat up on people more than us.
Pardon? Pardon?
Or you beat up on people more than us.
Not true. Mr. Executive Director, please get me off the hook here by continuing.
What's it worth to you?
My undying gratitude.
The next slide here is a breakdown of those 687 applications. As I noted, we're not in the business of denying applications for the social equity program. We do want to give folks an update and provide them an opportunity to update their applications if necessary, where there is more information that we might need. Again, as we evaluate them, there might be the simple fact that they're not eligible for that program, but we want to give them every opportunity to demonstrate eligibility before having that conversation. So you'll see, though, that there's been 135 that have been approved into Cohort 3. For those 135 individuals, those benefits accrued immediately. We have 230 that we've that are pending and still require our review. 4 applications have been withdrawn. And again, the majority, 318, have been reopened. A note here that I think is important for the commission to understand is that this information does work through our cannabis industry portal. Our staff most familiar with that portal, of course, are our licensing specialists. And this is reflective of the agency-wide commitment we have to the social equity program. Licensing specialists are actively working on these applications as well, lending a hand to get through this workload to make sure we're able to, in a timely fashion, review applications, provide the feedback where it's necessary, and get folks through this process. So I'm obviously incredibly grateful for that collaboration and the camaraderie that our staff have to support one another, but also that they're looking to cross-train each other and also in furtherance of our mission to get folks into this program successfully. So just wanted to provide that compliment, especially to our licensing specialists and Kyle Potvin, our director of licensing, for seeing that need, but also being able to lend a hand and provide some resources.
Commissioner Roy.
I just have a question on the reopened number, more information requested at 318. I was just curious if there's like a top 3 or top 5, you know, that keep happening, or are they all distinctly different? In other words, if there's guidance we could provide and an FAQ, is it the same things that we seem to be asking for, or are they all distinctly different?
Given the qualifications, I would say that there's certainly going to be a variance. The vast majority, though, seem to be that address documentation. What proves residence for that window of, I think it's 5 of the last 10 years. And so getting that documentation that demonstrates that eligibility seems to be at least the top one. And then I think after that would be really a smattering of requests. So that's again, anecdotally my best guess at this moment, but I could certainly provide further context and talk with Kevin, our Director of Equity Programming and Community Outreach, for any additional insight.
Yeah, the reason for my question, I just didn't know if we could provide more detailed guidance or future guidance
Sure.
that could help eliminate that first bump in the road, so to speak, which seems to be common.
What we've done over time is that application's probably been one of the applications that has evolved the most, and it's usually based on, as folks click through and progress in filling out the application, there are some narrative bubbles that pop up and identify this is what's requested, or this is what the regulation requires. Here are examples of what we'd be looking for to really assist folks in navigating that. That narrative has changed over time as we've gotten that feedback, and provides us the best opportunity to be very direct about what would qualify. But we'll certainly take that feedback into mind, and as we learn from this exercise, this only being our 3rd cohort, I think we've certainly progressively learned throughout the first 2, and it's been both our exercise of learning, but also seeking the feedback of participants and what they would have liked through the first 2 cohorts at least. So. But again, we'll certainly take that feedback into mind and make changes where necessary.
Thank you very much.
Sure. And I should note too, we do have FAQs that are available on our website for folks that they should consult if they have any questions, and we remain available as a staff. So if you have questions, please reach out as well. This next slide is a breakdown. I provided it last month, and so we'll just update the data on a month-to-month basis. But you'll see here that 382 of the 687 total, or 55%, identify as Black or African American, and 545, or nearly 80%, have identified the entrepreneur track as being of most interest to them, and that therefore they'd like to pursue licensure as the designation we would see coming from that track selection.
And that's been consistent with the previous 2 cohorts, that the entrepreneurial track by far is the dominant track that people are interested in. Is that correct?
Absolutely. That is absolutely correct. Yep. I should note as well that we do allow folks to change tracks as they learn more about it and as they advance through it, but certainly don't want to discourage anyone from pursuing a dream of licensure. So and instead, we would intend to support them in that that quest. So.
Commissioner Camargo, go ahead.
Just a quick comment, and Commissioner Stebbins, I don't know if you're if you're thinking the same thing, but I know you and I have talked a lot around the ancillary track. And I think, and you know, we'll hear more, I think, from you, Mr. Executive Director, about some of the outreach that's going to start, and education and awareness around our SCP program. But, you know, I would really encourage folks to learn more about the ancillary services and the ancillary track. I think it's something that we need to do a lot more outreach about, and just education and, again, awareness, because it is definitely an interesting niche for ancillaries. When we think about, you know, HVAC, when we think about plumbing, we think about carpenters, you know, graphic designers, IT, right? So there's a lot of non-plant touching jobs and businesses that can be created. I think it's one of the things that we spoke to the sheriffs yesterday. I was present at the sheriff's meeting yesterday, and it's something that we really talked about, to really let the industry and folks know out there that there's more to this industry than just sort of the brick and mortar. Commissioner Stebbins, am I getting a head nod?
I think he's a little bit in the shadows there, but I think he was nodding his head.
Yes, I am nodding my head. And Commissioner Camargo brings up a good point. And, you know, we also need to remind people looking at that ancillary track that, if I'm not mistaken, it doesn't require, you know, the licensure process through the commission. In my conversations with our new director, the SCP program director, Sibley, there still seems to be some misunderstanding or some confusion around the name title. And I know he's thinking of kind of moving ahead, if there's a new title we can give that track, or a way to, you know, again, as Commissioner Camargo pointed out, a better name for it that helps people understand what the opportunity is there in that category.
Thank you. Mr. Executive, I'm sorry, Commissioner Camargo, do you have a follow-up? Or no? Go ahead then, please, Mr. Executive Director.
Sure, thank you. And Commissioner Stebbins, you're absolutely right. That has been, in Kevin's short time with us, that is one of the observations he's had, is that he finds himself really educating a lot of folks, or explaining what that ancillary track in fact is. And again, as I pointed out earlier, we're willing to evolve and willing to update based on findings that, or observations from participants, as far as what did you find that worked, what did you find that didn't work, or what confused you, that we can help eliminate some of that confusion. So, and we'll look for other opportunities around just identifying those non-plant touching roles that this industry may offer. And again, I think one of the challenges we have is that, what does success in fact look like here? It may be that folks never interact with the agency again from an application standpoint, as far as agent registration or licensure, but they can still find success in this industry, and that's a benefit to us, and benefit to us meeting our mission. So a lot more learning to do, and I think also that willingness to evolve over time to make sure we're best serving those constituents of ours. So plenty more to come, without a doubt. Continuing here in the breakdown of those applicants we have before us, so you'll see that 464 or 67.5% identify as male, 636 or 92% have not identified as the status as serving as a farmer, and 652 or 94.9 or 95% have not identified as a veteran in this program. Again, that's data we're going to track year over year, cohort over cohort, to see that we may be checking several boxes as far as our mission is concerned through this one program. Of those that have been approved, so that's the smaller number, I believe it was maybe 135 or so. This information, as well as something we'll continue to track, is 135. 48% or 67 individuals identify as Black, African American, 16 individuals or 11% identify as Hispanic, Latinx, or Spanish. And again, seeing the trend here of 87% or 118 of the 135 look to pursue the entrepreneur track. Same slide as before, as far as gender breakdown, as well as farmer or veteran status. 74.8% of 101 individuals identify as male, 97% did not identify as a farmer, and 73% did not identify as a veteran. This next set of slides here is just an update on some of the outreach that we have already conducted to date. Of course, more remains necessary, and more will continue to come. But I want to just give the commission an update of the work that has been done to date. You'll see here that we spent $12,300 on an integrated marketing campaign that we actually launched this summer for the open application process for Cohort 3. That included both print and digital, as well as social media ads that look to target those areas of disproportionate impact throughout Massachusetts. And of course, based on last month's conversation, which will also continue today, that did include Lawrence as well. We looked at areas with interests such as cannabis legalization, entry-level job searches, career changes, industries tangential to the marijuana industry, of course, those ancillary businesses. We also chose and elected to run ads in Spanish. And I should note as well that the Lawrence conversation certainly happened before last month's meeting, but certainly relevant in this context today as well as last month. Those ads did actually identify and emphasize the entry as well as the ancillary tracks, knowing that the vast majority of the entrepreneur tracks seem to have sufficient interest in it. And we wanted to educate folks about other job opportunities in this industry where if you may not want to pursue licensure, our social equity program can still serve you and provide you either that 101 level, entry level coursework just to make you a certainly more attractive candidate to any entry level job, or might also support and supplement your knowledge of this industry to make you more attractive as your business today. Again, that might be HVAC, electrical, IT. This program can serve a lot of different opportunities to folks, and wanting to educate them that it doesn't just pursue licensure, it doesn't just support licensure, it supports the wide array of this industry and what opportunities might exist through its introduction to the Commonwealth. We're going to be continuing our outreach efforts as well. So that was a bit of a look back. Now looking ahead, we've partnered with Elevate Northeast to increase access to Cohort 3, which is actually part of the rationalization for extending that application period. I should note that the volume of applications we have right now far surpasses Cohorts 1 and 2. That doesn't mean that we continue or we consider ourselves done with recruitment. Based on our learning management system, we can support any number of applicants. And obviously, if we had to upgrade a subscription or something of that nature, that cost is going to be, I think, an investment on our part and not something that would prohibit our ability to serve folks. So you'll see here that on October 28th, we're going to conduct a job fair from 6:30 to 8:30, as well as have an application workshop, a hands-on application workshop on the 4th to really help folks fill out those applications and make sure that when they do submit, they're ready to go and that they understand their qualifications. And we're able to facilitate their navigation of that process. So again, we're excited about the opportunity to partner with Elevate and looking forward to working and collaborating with them, as well as looking forward to working with applicants directly to help them navigate that application process. That'll be, I think, a really valuable exercise for us to understand if there's any trip ups or anywhere that someone might stumble in the application process. We can see it firsthand, help them navigate it, but then also improve our process moving forward as well. And to look for those opportunities where if there's a consistent theme, we can make those changes on the fly.
Any questions before we move on?
And this is the last social equity program slide, so I'll move on.
Just asking that question before we move on, because I know we're changing topics.
I was just going to say thank you. This is great, and thank you for working with Elevate Northeastern. I think this is a really good move, and I know we've been talking about it for a while. So thank you for making sure that this gets done and that the budget's there for it. So, and I'm hoping that all of us as commissioners and the CCC, do our own personal outreach to community organizations and our networks, and places that we know can benefit from this. So thank you so much. This is great.
Any other comments or questions? Please go ahead. It looks like we are being joined by our Chief Financial Officer. Hello.
We have one more slide.
She's just I'll say a little bit, Adriana.
If you'll indulge me for just one moment longer, and Commissioner Camargo, thank you. Our credit is certainly due to our staff, Kevin Sibley, Cedric Sinclair, but also knowing that any procurement or contract work goes through any number of staff here. As I noted in the application review process, this has really been, I've been very impressed by, and I think frankly inspired by the collaborative nature and seeing our staff come together and work on this. It's something that no one, again, considers to be done or complete or satisfied. It's a matter of the work is necessary, the work is worth it. And they've all really rolled up their sleeves to get this done, and they'll continue doing it over time. So I'll accept the thanks on their behalf primarily because it's they're the ones that are doing that work. So speaking of staff and doing the work, we have some number of positions I want to elegantly segue into, which is we've onboarded some new staff, including constituent service associates, as well as a research analyst. They began with us on the 4th of October. We're in the final stages of identifying candidates for the role of executive assistant, as well as 2 associate enforcement counsel roles to support Rebecca Lopez, our enforcement counsel on Yao GB's team. We've posted the position and are now screening applicants for the desktop support analyst to help support our growing IT needs, especially in this remote environment, as well as adding more staff obviously requires us to increase bandwidth across the board. And as I noted earlier, and we discussed last month, we are looking for the role of director of testing. With your approval, having approved the job description, we did post that position, and that position remains open. And again, if there's anyone that's interested in things like toxicology and microbials and those really exciting things, I would encourage you to apply and give us every consideration because this is a very exciting industry where public health is something that is paramount to what we do, and we need all the help we can get as far as ensuring the consistency of those products and making sure that inventory that hits our store shelves, consumers, patients alike have the confidence in those things. So please, if you're interested, be willing to join us. We would be excited to have you. And certainly as we build out that team, I know there's a lot of work to be done, a lot of exciting work to be done in this cutting edge environment. And that's my sales pitch.
I have a quick question.
Margo?
Yeah, for the director of testing, all other positions are very important. I'm curious for the director of testing, where are we promoting it besides the regular, I think, places that we put it? Because I feel like this position is so key. I'm very excited about this position. So I'm just curious, how are we doing outreach? Are we reaching out to, you know, we have so many institutions here in Massachusetts and medical institutions. I mean, we're the Mecca. So I'm just curious, how do we find the right person for this?
Yeah, it's a great question. I know it's something that I don't want to lie to you. So the answer is I'm not entirely sure where else. What I can tell you though is that that's an exact conversation that I had with Erica White, our chief people officer. I know that she's had that conversation with Cedric on our communications team of just looking for different opportunities to post positions like this, as well as even like the desktop support analyst. There are IT trade groups and publications that we want to be able to plug into. So for each position, I know she takes a unique lens and looks at, are there industry-based resources to reach out to? I know we also post on the traditional job boards, but your point is well taken as far as this is a specific role. I should also note that this role closes, I believe it's on Friday on the 16th. So actually today being the 14th, so Saturday ultimately would be when it closes. So we're running out of time. Of course, if the applicant pool isn't there, we'll certainly consider extending that, or we're fortunate enough, I think, at this point to have a pool as well as a bench here at the agency where, and also I think a reputation within the industry of being strong on testing. Is again, that gets us a mixed reaction from industry, where I think we have some of the strongest regulations in the country. That's something we're proud of. But as a result, compliance with our standards is also, it's a high bar. So
Absolutely. Thank you so much.
Roy? Sorry, Commissioner Roy.
Thank you, Mr. Chairman. Mr. Executive Director, no, I just want to thank you for this and the importance being placed on all the positions, but specifically Director of Testing. And this goes to one of your first slides where we have almost 100,000 qualified patients now online who rely on cannabis for their medicine to treat whatever comorbidities or illnesses that they may face. And the need for this is greater than ever. And you know, and of course we want folks who are using adult use, you know, public safety and public health are paramount in the legal market and the regulated market. So this kudos to having this position. And I just want to echo my fellow Commissioner Camargo. There's so much talent, in Massachusetts, and I'm excited at the, whoever we bring on to provide oversight in this area. So thank you very much for that.
Of course.
Any other questions before we move on to our next topic? Okay, Mr. Executive Director, please keep going. And I guess now we can welcome our Chief Financial Officer.
That's right. So our last month's meeting.
Where are you, Adriana?
There you go.
Welcome. Thank you for joining us today.
Adriana, welcome. Commissioners, as you know, Adriana serves as our Chief Financial Officer here at the agency and has really been the steward of our funding really since our inception. So we've been very fortunate to have her leadership, and I wanted to give you an opportunity to hear from her as we close out the previous fiscal year and embark on our new fiscal year. Again, she and her staff work every day to make sure that we are timely in our payments, that we are up to date in our receipts, and ultimately we're responsible for all necessary filings with the administration as well as with the legislature. And I think has been really one of the primary reasons that we continue to find the support that we do from both the executive branch and the legislature, just based on our reputation as being a good fiscal steward. And again, a lot of that is due to Adriana's leadership. So wanted to provide you the chance to hear from her directly and ask any questions you may have. And certainly I'll remain around if there's something that I can be helpful with, but I wanted you to hear from Adriana. So here she is.
Good morning, and thank you, Mr. Executive Director and Commissioners. So as Sean said, I'll be presenting on our budget, primarily focusing on fiscal year 21, which just wrapped up on June 30th, 2021. As you all know, the Commission is funded through the state operating budget. So each year we submit our budget estimates to the legislature and the governor. And as Sean kind of alluded to right now, since FY18, by and large, the governor and the legislature have supported our estimates in the final budget as well as any supplemental budgets. So on this slide, this chart shows our total available budget compared to our total actual expenditures. The budget column in particular reflects the total amount appropriated in the state operating budget and any supplemental budget bills. And the actual column reflects our total expenditures across the agency on everything from office supplies to laptops to payroll. And as you can see, since FY18, our actual spending has mostly gotten closer to our total available budget, which is the trend you want to see. Next slide. This slide provides a kind of a deeper dive, a comparison of our budget and spending by each of our three line items between fiscal year 18 and 21. So fiscal year 18 really marked our first year on the books of the state budget. As you all may recall, the Commission started operating in the fall of 2017 and gradually added staff and contracts through June 2018. I also just want to note that the zero amounts that you see for the medical use of marijuana program are due to the fact that the program was not transferred to us from DPH until halfway through fiscal year 19. But turning back to FY18, we spent 32% of our total available budget that year based on the total budget available. Moving into fiscal year 19, we spent 76% of our total budget. We got closer to our total amount, which is great, especially for the public awareness campaign where we spent 95% of what was available. And as I just noted, we had just taken over the medical marijuana program halfway through that year, and I think the numbers reflect that. Moving into fiscal year 20, we definitely wrapped up on a stronger note. Overall, our actual spending was 91% of our total budget. And as you can see, we did pretty well in operations and public awareness campaign, and also the medical program line item. And as the slide notes, fiscal year 21 was a unique year. And I think the way it plays out here on the slide demonstrates that. I think a lot of it goes back to the implications and uncertainty related to the pandemic. So for the first half of fiscal year 21, the Commission, like other state agencies, was being supported by interim budgets. And so given that uncertainty about the final numbers and where everything was going to land, I think it's fair to say that we took a pretty cautious approach to any new hiring or procurements during that time. But luckily, the fiscal year 21 budget was finalized in December of 2020, which is right about halfway through the fiscal year. So once we knew those numbers, and we were obviously very grateful for the support we got in the budget, we focused on implementing our hiring and procurement plans over the course of 6 months, January 2021 through June 2021. So our actual spending reflects those efforts in the context of this relatively short time when you compare it to a full year of 12 months. And I just want to give props to everyone at the commission for making that happen, especially our Chief People Officer, Erica White. So while it would have been ideal for FY21 to continue our upward trend that we saw in FY19 and FY20, I think it is important to note that we had a shorter than usual time frame to make that happen. Next slide, unless there's a question. Okay. This slide shows more detail for actual spending in fiscal year 20 and 21, and I'll touch on some of the differences. At a high level, the differences between the 2 years can largely be attributed to the one-time cost that we incurred in FY20 and the unique nature of FY21, which I just explained. So in the operations line item, the admin expenses line, for example, largely reflects the cost of moving and relocating to 2 new offices, and that was around fall, winter of 2019. Before the move, we had borrowed most of our furniture, as some of you may remember, from our landlords at 101 Federal. Once we moved to our satellite office in Boston and our headquarters in Worcester, we obviously needed to buy furniture and make sure everything was all set for everyone. So those costs were about $400,000, and that includes, you know, the delivery, the installation, and of course the furniture itself. In terms of office space, I think that reflects the fact that we moved from our 101 Federal office, moved into the two new offices in FY20 halfway through the year. So FY21 reflects the full year cost of our headquarters and satellite space. And then in terms of IT, we obviously had to make considerable investments to ensure that both offices were equipped with state-of-the-art technology. So those costs were one-time in nature, of course, as well, one-time investments of around $250,000, which we didn't need to continue in FY21. Other than that, in FY20, we also had some one-time contracts. For example, we worked with an outside vendor for our website as $140,000. That did not continue in FY21. We also had the costs of moving, also not necessary in FY21. The social equity contract line here is just the contract. It's not staff or other costs related to the social equity program. And the drop here isn't really a change in the program, it's a change in the number of vendors that we had. So in FY20, we had 6 vendors, and in FY21, due to the way things were changed, there were 3 vendors, and the expenditures reflect that. Moving on to the medical program, the majority of the differences are same thing, kind of one-time in nature in FY20. For example, once we took over the medical program, we also took all over their files. So there was a one-time cost in FY21 to get those files transferred and scanned so that we could ensure that they were properly stored, and that was around $21,000, for example. And with the shift to remote work for the majority of FY21, we had reduced reliance on rental vehicles for our compliance officers, so it dropped from around $40,000 in FY20 to $10,000 in FY21. In terms of the IT cost difference that you see here, it's primarily related to the cost we incurred in FY20 for the patient portal, which at that time was still being operated through EOHHS. And since we have now taken that over with JD Software, the costs have actually reduced. And in addition, the payroll cost decrease that you see here is due to turnover in staff that we had on the patient support side and compliance officer side. Any questions? Okay. Next slide. This slide demonstrates our revenue collections from application, licensing, and other fees between fiscal year 18 and FY21. And I think it's fair to say that these numbers are really a credit to the work of the licensing, investigations, and enforcement teams. In terms of the table, it is organized based on the numbers assigned to these fees in the state accounting system. And as a reminder to all, these fee collections are deposited in the Marijuana Regulation Fund, along with excise tax collections. So while this revenue does go into the fund, the commission does not administer the marijuana regulation fund, and it's not a trust fund.
So could I interrupt to point out what is,
Sure.
I think, obvious to everybody, that if you look particularly in the last 3 fiscal years, or particularly the last 2 fiscal years, these fee collections by far outweigh our budget.
Yes, which is great.
Just noting that for general consumption.
Thank you. So yes, as the chairman just noted, we have definitely gotten pretty great numbers in fiscal year 20 and 21. FY18 was obviously our first year, and we had just started collecting revenue at the tail end of that fiscal year, which would have been around, May, June of 2018. So in FY19, we definitely were able to collect more, with a good chunk of it coming from the medical marijuana program. But as you can see, overall, we're doing really well in both the medical and adult use side. So I think that's all I have on this slide. Next slide. And so, as I alluded to in the beginning, we have been fortunate to receive the support from the legislature and the governor for our budget each year, and FY22 is definitely consistent with that. We are now working on executing against this budget for this current fiscal year, and also starting to work on our plans for FY23 as well. And this concludes my presentation, actually, so I'm happy to take any questions.
Thank you, Adriana. I have a question, but let me ask do my fellow commissioners have any questions for Adriana before I ask mine? Then if I could, and this is kind of in the category of no rest for the weary, can you outline the process and timeline going forward for the fiscal 23 budget?
Sure, unless Sean wants to take that question, or I can cover it.
Let me provide at least a little bit of our internal process, and then Adriana, if you want to lay out sort of how that then flows into the traditional budget process as far as the statewide. But our budgeting process is actually underway as we speak, and it's really department based as far as what are your needs and requests as far as staffing, support, and other things. I want to then take those requests, obviously work with Adriana, Alyssa Stack, our COO, as well as individual commissioners, and ensure that your priorities are reflected in this budget making process as well, which is true to form as far as previous fiscal years have been developed. We begin now because the state's budget process is frankly underway as well. I know that A&F is, and our analysts there are working and expecting information from us, but this exercise allows us to be aware of our needs. Now, granted, every need or want of each department is unlikely to be able to be met necessarily. It does force us to have some, I think, strategic conversations, as well as I think at the end of the day, some difficult conversations of this is what we can realistically request and afford. But it also helps us build out a narrative for our request. To your point, Mr. Chairman, we are a revenue generator for Massachusetts. I don't think anyone would dispute that. We also have to be mindful that we are subject to legislative appropriations. We must both seek and secure a budget. One unique aspect of our budgeting process, and I don't know that it's unique exclusively to our agency by any means, is we've asked our staff and our various department heads to think about 2 years out. The reason for that, now granted, our request is going to be a 1-year budget. So FY22, we've already requested and secured. FY23, we're in the process of requesting. The reason I ask for that 2-year budget from our department heads, though, is what's your planning look like? What's your strategy for your department? What's your growth look like? What are your needs going to look like? But don't think about it year to year. Where do you want to be in 2 years from now? What's your hiring plan look like, and those types of things? But that's underway, and I think also beginning probably in the next few weeks, I'll begin to meet with, along with Adriana and probably Alyssa Stack, with each commissioner to ensure that you are both aware of each department's request, but that you can see and ultimately have input into our budgeting process and ensure that it does reflect your priorities as well in any ultimate submission we make. And I think that segues into the state budgeting process, which I know Adriana has a deep familiarity with, so I don't want to trip over myself and try to educate you on it where she's best equipped.
Thank you. Yeah, just very briefly, as Sean said, we're working on our internal numbers. I will be using those internal numbers and decisions to submit information to the Executive Office for Administration and Finance. which then they'll use to develop their budget for the governor's budget proposal, which typically comes out around the end of January. After that, we work, or I should say concurrently, we also work with House and Senate Ways and Means to submit our estimates for fiscal year 23. There's usually a hearing for the Joint Committee on Ways and Means where we testify, Chairman and the Executive Director, typically around February and March. And then that's followed by the House releasing their budget in April, and the Senate following suit in May. And then there's a conference committee to negotiate any differences and usually finalize a budget around July.
Thank you, Adriana and Executive Director. I wanted to just pile on if I could. We have gotten what we've asked for pretty much every year since our inception. This goes back to 2017 when we started without a budget. The legislature and the governor have been very gracious in supporting our budget request pretty much every step along the way since then, and we're deeply grateful for that. My personal opinion is that part of why we have gotten what we've asked for in every budget cycle is because I think we've made it clear that we are careful stewards of the state's money. And I think the original slides that Adriana showed in terms of actual versus budget, we are very careful in terms of how we request money and how we spend money. And I think that's something that weighs on the legislature's decision to support our budget requests historically. So again, we're grateful for that, but I also wanted to recognize Adriana for her leadership in helping us be perceived, I think, appropriately as an agency that is very careful and thoughtful about how we use the state's money, and very careful tracking that. So, Adriana, thank you for your role in that. I hope and expect that we'll continue that trend in fiscal 23. But I just want to acknowledge, Adriana, your leadership in getting us to this point. Thank you very much for that. Commissioner Roy, you have a question?
Thank you, Mr. Chairman. Adriana, I want to thank you so much for this presentation. It was very informative, and I just am curious in looking at how the payroll goes up exponentially, but when we do go in front of the legislature, I think it's important as the commission to say not only is our payroll going up, but because our licensees are coming on board, they're going up. So we bring on more inspectors or folks in the licensing department, but the fines have also gone up. And not that we want to fine people, we don't, but we want to make sure there's 100% compliance. So payroll may go up, but the licensees have grown and the fines have grown, which offset the payroll as well, because we're looking out for public health and public safety. And so we expect 100% compliance. We're not out, just to find people to be evil. There's a reason for it. But I would like, if there's a possible way in a slide, we could show a correlation between increase in payroll, increase in inspections or inspectors or license department, and the fines, how I noticed they grew from 20 to 21. So I just think there's a correlation there. That just not that we're not just padding our payroll, so to speak.
Yes, I think that's what I say. I can get back to you on that.
Other questions or comments, Commissioner Camargo?
Yeah. So Adriana, obviously, and first of all, thank you for your leadership. I didn't know you before the commission, but you have an amazing reputation at the State House and within our community. So thank you for the work that you do, really. And you and I and Commissioner Stebbins, met a week ago. We went through this presentation, so you answered a lot of my questions. So I guess I think it's more of comments, because I'm really looking forward to our meeting next week. I believe we're scheduled for a meeting to talk about FY23. I think, and I'm glad, Mr. Executive Director, that you mentioned that you've given the leadership team or the teams at the CCC a sort of a 2-year kind of window. Because I've said this in the past, we need to think strategically. We have to think about what does it look like? How are we building out this, this infrastructure at the CCC in order to complement, what's coming ahead of us, right, in terms of the industry, and it keeps growing and growing. So I'm really excited to hear that. But also I want to make sure that we're also, and I know this is part of it, but I need to say it, that we're also thinking about how we're growing our team and our staff. you know, how are we looking at those performance evaluations? You know, we haven't got into much in terms of staff raises or anything like that. It's probably nothing that we probably touch, but, you know, I think it's important because, you know, I've said this before, and a lot of us have worked in state government. We have a really interesting team of experts in the field that have built this commission the last 4 years and continue to work on compliance in this industry. So I think it's really important to understand that. And then also, you know, Adriana, you said to us on our onboarding, and you keep saying it to us, which is great, right? A lot of the money that goes into the marijuana regulation fund is not our trust fund, right? we can't just take for them and say, hey, we want this, we want that. However, I think it's important for us, and maybe we can talk about this, you know, Chairman, you know, afterwards, is, you know, what is the marijuana regulation fund, right? What does it look like? Where is it going? I think that the community has asked, you know, I think all of us have received emails in the beginning and constantly receive questions around that. I think at some point we should also create some awareness and some education on what is the marijuana regulation fund, where does it go, and what it's not. So thank you for all your work, and thank you for this really great presentation.
Thank you.
Thank you, Commissioner.
Any other questions or comments for Adriana? Okay, well then again, Adriana, our thanks not just for this presentation, but for your leadership for all the time you've been here in terms of making sure that we are a well-oiled machine in terms of our fiscal management. And I think that reputation has helped us enormously in terms of our dealings with Congress or the legislature and the governor. So thank you. Really appreciate it.
Thank you, Mr. Chairman.
Hope you'll come back and join us again sometime.
Thank you.
Sean, any closing comments? This is the end of your executive director's report, if I'm correct.
It is. I neglected to mention just a few non-slide updates, and that's probably why I neglected them. Just a few items I think are worthy of the Commission's consideration. The first is our research department. You'll certainly hear from Dr. Johnson later today about the potency study that the statute required. But as you know, as part of building out what we would describe as a center of excellence for our research is that part of our spirit to that is that we don't sit on our research. We share it, we broadcast it, and we let everybody that is interested in knowing what we're up to or what we have found, we try to bring it to them and identify that we as state government can be a resource in furthering a public discussion and public dialogue about cannabis legalization, as well as the both pros, cons, and not so much taking the side, but instead just trying to inform any discussion that may be occurring. So one development of that is that the research department was recently published. A paper entitled A Scoping Review of Data Sources for the Conduct of Policy Relevant Substance Use Research was published this month, October 4th, in Public Health Reports, which is the official journal of the Office of the U.S. Surgeon General, as well as the U.S. Public Health Service. So basically the data study that we conducted was turned into a paper, which was then published in that journal. So that's obviously an exciting development for Julie and her team, and again furthers our objective of being that center of excellence and contributing to a nationwide conversation. Next item I just wanted to alert the Commission to is Commissioner Camargo. Congratulations, you were identified on the Boston Business Journal Power 50. So hopefully you knew that, and I'm not breaking that news, but wanted to flag it for the Commission's information as well as congratulate you publicly. And hopefully embarrass you a bit publicly.
I'm embarrassed.
and lastly, this is breaking news as of last night. The Commission for this calendar year has, not the Commission, excuse me, the industry for this calendar year has surpassed $1 billion in total adult use sales, which is obviously a milestone that obviously bears tracking and information. But as you know, since our sales began in 2018, November of 2018, we've surpassed $2 billion in sales. And just wanted to point out that our open data platform is actually where we learned about it, which publishes directly from our metric seed-to-sale tracking system. So just information worthy of consideration. And that's it as far as my reports or information that were not included in your slide deck. So thank you for indulging that.
Thank you, Mr. Executive Director. Congratulations, Commissioner Camargo. Congratulations to the industry, but to all of us for the sales milestone that Sean just referred to. That's a big deal, and it means we've come a long ways as a commission, as an industry. Obviously, we have a long ways to go, but let's celebrate that milestone because it's quite an accomplishment. And obviously, the leadership of Sean and the staff has a lot to do with that. So thanks to everybody. But okay, I think we can catch our breath and then get going. What I'm going to suggest, it's 11:30. Let's take a break before we get into the licensing part of the agenda. So if it's okay, it's 11:30. Can we take a 10-minute break? Does that work for everybody? So we are in recess until 11:40. See you all then. Okay, it's 11:40. I see Commissioner Stebbins. Could I see Commissioner Camargo, Commissioner Concepcion, and Commissioner Roy? Great. Okay, is everybody ready? Let's go back into session. Okay, the commission is back in session at 11:40 a.m. Thank you for rejoining us. I'm going to suggest that we go through all of the licensing materials and discussions and votes, changes of ownership, renewals, finals, and provisionals, and then we'll take a quick lunch break and come back after that and go through the commission discussion and vote items. Is that okay with everybody? Okay, and I believe, if I'm correct, Mr. Collins, that Ms. Defoe is going to be leading us through the licensing discussions today. Is that correct? Hi, Suko.
Hi, Chairman.
How are you?
I'm good, thank you.
Welcome back, as always.
Thanks.
So let's start, if we could, with changes of ownership. We have 5 to review. If you could start with Higher Purpose Corporation, please.
Sure. The licensee here is Higher Purpose Corporation. They're seeking a change of ownership and control over to adult use licenses. They're requesting to add 1 individual. Additional information is contained within the executive summary for the commission's review and consideration. Therefore, the commission staff do recommend review and decision on this request, and if approved, do request your approval be subject to the conditions before you.
Thank you. Are there any questions or comments before I ask for a motion? Could I ask, I see some of my fellow commissioners are on mute. Could, for this portion of the meeting, could you unmute yourself, please? Thank you. If there are no questions, then could I ask Commissioner Camargo, would you make a motion, please, to approve the staff recommendation on change of ownership for Higher Purpose Corporation?
So moved.
Thank you. Commissioner Concepcion, could I ask you to second that motion, please?
Second.
Thank you. Let's make sure that Commissioner Camargo made the motion, seconded by Commissioner Concepcion. Commissioner Camargo, your vote, please.
Aye.
Thank you. Commissioner Concepcion.
Aye.
Thank you. Commissioner Roy.
Aye.
Thank you. Commissioner Stebbins.
Aye.
Thank you. Commissioner Hoffman, aye. Let the record show that the commission approved the staff recommendation on change of ownership for Higher Purpose Corporation by a vote of 5 in favor. Commissioners Camargo, Concepcion, Roy, Stebbins, and Hoffman with none opposed. Thank you very much. Next up, Ms. Defoe, JBAM Incorporated.
Yep. The licensee here is JBAM Incorporated. They are seeking a change of ownership and control over 1 adult use license. They're requesting to add 1 individual. Additional information is contained within the executive summary for the commission's review and consideration. Therefore, commission staff do recommend review and decision on this request, and if approved, do request the approval be subject to the conditions before you.
Thank you very much, Ms. Defoe. Any questions or comments before I ask for a motion? Then Commissioner Concepcion, could I ask you please to make a motion to approve the staff recommendation on change of ownership for JBAM Incorporated?
So moved.
Thank you. Commissioner Roy, would you second that motion, please?
Second.
Thank you. Let the record show that Commissioner Concepcion made the motion, seconded by Commissioner Roy. Commissioner Camargo, your vote, please.
Aye.
Thank you. Commissioner Concepcion.
Aye.
Thank you. Commissioner Roy.
Aye.
Thank you. Commissioner Stebbins.
Aye.
Thank you. Commissioner Hoffman, aye. Let the record show that the commission approved the staff recommendation on change of ownership for JBAM Incorporated by a vote of 5 in favor. Commissioners Camargo, Concepcion, Roy, Stebbins, and Hoffman with none opposed. Thank you. Next up, Ms. Defoe, there are 2 separate changes of ownership for Tree Market, 1 in Lynn and 1 in Taunton. So let's start with Tree Market Lynn LLC, please.
Okay. The licensee here is Tree Market Lynn LLC. They are seeking a change of ownership and control over 1 adult use license. They're requesting to add 3 individuals and 4 entities. Additional information is contained within the executive summary for the commission's review and consideration. Therefore, commission staff do recommend review and decision on this request, and if approved, do request your approval be subject to the conditions before you.
Thank you, Ms. Defoe. Are there any questions or comments before I ask for a motion? Then Commissioner Roy, could I ask you please for a motion to approve the staff recommendation on change of ownership for Tree Market Lynn LLC?
So moved.
Thank you. Commissioner Stebbins, would you second that motion, please?
Second.
Thank you. Let's make sure that Commissioner Roy made the motion, seconded by Commissioner Stebbins. Commissioner Camargo, your vote, please.
Aye.
Thank you. Commissioner Concepcion.
Aye.
Thank you. Commissioner Roy.
Aye.
Thank you. Commissioner Stebbins.
Aye.
Thank you. Commissioner Hoffman, aye. Let the record show that the commission approved the staff recommendation on change of ownership for Tree Market Lynn LLC by a vote of 5 in favor. Commissioners Camargo, Concepcion, Roy, Stebbins, and Hoffman with none opposed. Thank you very much. Next up, Ms. Defoe, Tree Market Taunton LLC.
Yes, the licensee here is Tree Market Taunton LLC. They're seeking a change of ownership and control over one adult use license. They're requesting to add 3 individuals and 4 entities. Additional information is contained within the executive summary for the commission's review and consideration. Therefore, commission staff do recommend review and decision on this request, and if approved, do request your approval to be subject to the conditions before you.
Thank you very much, Ms. Defoe. Are there any questions or comments before I ask for a motion? Then could I ask Commissioner Stebbins, would you please make a motion to approve the staff recommendation on change of ownership for Tree Market Taunton LLC?
So moved.
Thank you. Commissioner Camargo, would you second that motion, please?
Second.
Thank you. Let the record show that Commissioner Stebbins made the motion, seconded by Commissioner Camargo. Commissioner Camargo, your vote, please.
Aye.
Thank you. Commissioner Concepcion.
Aye.
Thank you. Commissioner Roy.
Aye.
Thank you. Commissioner Stebbins.
Aye.
Thank you. Commissioner Hoffman, aye. Let the record show that the commission approved the staff recommendation on change of ownership for Tree Market Taunton LLC by a vote of 5 in favor. Commissioners Camargo, Concepcion, Roy, Stebbins, and Hoffman with none opposed. Thank you. Next up, Ms. Defoe, Vanguard Cannabis LLC, formerly known as Cannabis LLC. Please go ahead.
Yes, the licensee here is Vanguard Cannabis LLC, formerly known as Cannabis LLC. They are seeking a change of ownership and control over 2 adult use licenses, and they are requesting to add 3 individuals and 3 entities. Additional information is contained within the executive summary for the commission's review and consideration. Therefore, commission staff do recommend review and decision on this request, and if approved, do request your approval to be subject to the conditions before you.
Thank you very much, Ms. Defoe. Are there any questions or comments before I ask for a motion? Then could I ask Commissioner Camargo, would you please make a motion to approve the staff recommendation on change of ownership for Vanguard Cannabis LLC, formerly known as Cannabis LLC?
So moved.
Thank you. Commissioner Concepcion, would you second that motion, please?
Second.
Thank you. Let the record show that Commissioner Camargo made the motion, seconded by Commissioner Concepcion. Commissioner Camargo, your vote, please.
Aye.
Thank you. Commissioner Concepcion.
Aye.
Thank you. Commissioner Roy.
Aye.
Thank you. Commissioner Stebbins.
Aye.
Thank you. Commissioner Hoffman, I let the record show that the commission approved the staff recommendation on change of ownership for Vanguard Cannabis LLC, formerly known as Cannabis LLC, by a vote of 5 in favor. Commissioners Camargo, Concepcion, Roy, Stebbins, and Hoffman with none opposed. Thank you very much. At this point, Ms. Defoe, are there any other changes of ownership for consideration?
No, there are not.
Okay, thank you very much. Then let's move on to renewals. And before we get into the specific licensees, I know that Commissioner Camargo wishes to make some opening comments. Please go ahead.
Thank you, Chairman. I love renewals.
I'm sorry, what did you say? I didn't miss that.
I said I love renewals.
And I'm glad you do.
I'll just remind folks out there who are watching, seems like there's 101 attendees watching today, and whoever watches this afterwards, that the reason I review renewals and I go through them, one is as a new commissioner, it's so educational to see what the industry is doing, a year or 2 years later after they've already, opened their doors. So again, just learn a lot, but also most importantly to me, and I think also to my fellow commissioners here, is making sure that we are upholding the equity mandate when it comes to positive impact plans and diversity plans, and that folks are hitting their goals to the best of their ability and or pivoting. So quick comments on some folks. Central Ave Compensation Care, just want to give them a quick shout out. They have a great demographics chart that's very simple to understand. It gives you a lot of clarity on their demographics, so thank you. Fourscore Holdings LLC, I just want to say thank you. You guys are located in Sturbridge and recently did a $20,000 donation to New Hope in Worcester, which is a veteran organization. So thank you for thinking of our veterans, a very important population to us. Also, High Hopes. They've been working with the Last Prisoner Project, Dimas House in Worcester, and they've created a sort of a collaboration with the Wachusett Business Incubator and Battle Brothers Foundation. So thank you for that. Also, quick comment to Liberty Market. Liberty Market has been using local vendors and artists for vendor merchandise. You know, we talked earlier about the SCP program and the ancillary services, right? So when I think about artists and vendors, here's another way where the industry is using local vendors to participate in their work. Mass Wellspring. I just want to thank you all because I don't know if it was our staff, maybe it was our staff, but you all updated and resubmitted your positive impact plan, and you guys just opened up about 6 months ago. So I think that, you know, it takes a while from when you start this process to when you actually open doors, and for folks to be revising and relooking at their positive impact plans and diversity plans and saying to the commission, hey, we're not here, but we're here, let me resubmit. Kudos to you all for doing that. So those are my comments, and thank you again, Chairman.
Thank you, Commissioner Camargo, and thank you again for the focus that you're providing on this important issue. Really appreciate it. Any other comments from my fellow commissioners before we get going on these? Then, Ms. Defoe, do you have any comments before I'm going to break this down into several rosters, but any comments overall on the renewal process before we get going?
No, sir. Okay,
thank you. I'm going to suggest that we're going to go through 3 rosters for adult use and then 1 for medical renewals. Commissioner Camargo has requested additional conditions on 2 sets of renewals, and so the first roster we'll go through is I through K, which is the 3 Curaleaf, Massachusetts Incorporated renewal applications. The second roster we'll go through is AA through CC, which are 3 renewal applications from Theory Wellness Incorporated, and on both of those groups, Commissioner Camargo has requested additional conditions. We'll then go through the remainder of the adult use renewals as a roster and all of the MTC renewals as a roster as well. So let's start, if we could, with I, J, and K, which are 3 renewal applications from Curaleaf, Massachusetts Incorporated. Let me read the additional condition that has been requested by Commissioner Camargo on these 3 renewals. Specifically, within 90 days, the licensee shall provide an update on how many staffers attended trainings stated in their diversity plan update dated 8/18/21. Are there any other questions, comments, or suggested or requests for additional conditions before I ask for a motion and a vote? Then could I ask please for a motion to approve the staff recommendation to issue renewals to Curaleaf, Massachusetts Incorporated, MRR 205-868, MCR 140076, and MPR 243-677, subject to the additional conditions requested by Commissioner Camargo. Could I have such a motion, please, Commissioner Concepcion?
So moved.
Thank you. Could I have a second, please, Commissioner Roy?
Second.
Thank you. Let the record show that Commissioner Concepcion made the motion to approve, seconded by Commissioner Roy. Commissioner Camargo, your vote, please.
Aye.
Thank you, Commissioner Concepcion.
Aye.
Thank you, Commissioner Roy.
Aye.
Thank you, Commissioner Stebbins.
Aye.
Thank you, Commissioner Hoffman. Aye. Let the record show the commission approve the staff recommendation to issue renewals to Curaleaf, Massachusetts Incorporated for 3 licenses, subject to the additional conditions requested by Commissioner Camargo by a vote of 5 in favor. Commissioners Camargo, Concepcion, Roy, Stebbins, and Hoffman with none opposed. Thank you. The next roster that I'd like the commission to consider, as I mentioned before, is AA, BB, CC, the 3 renewal applications from Theory Wellness Incorporated. The additional condition requested by Commissioner Camargo is specifically within 90 days, licensee to update and resubmit their positive impact plan uploaded on August 4th, 2018 to include their original or their ongoing social equity program plans and future outcomes. Are there any other questions, comments, or requests for additional condition on these 3 renewal applications? Then could I ask, please, Commissioner Roy, would you make a motion, please, to approve the staff recommendation to issue a renewal to Theory Wellness Incorporated for these 3 licenses, subject to the additional condition requested by Commissioner Camargo?
So moved.
Thank you, Commissioner Stebbins. Could I ask you to second that motion?
Second.
Thank you. Let the record show that Commissioner Roy made the motion, seconded by Commissioner Stebbins. Commissioner Camargo, your vote, please.
Aye.
Thank you. Commissioner Concepcion.
Aye.
Thank you, Commissioner Roy.
Aye.
Thank you, Commissioner Stebbins.
Aye.
Thank you, Commissioner Hoffman. I let the record show that the commission approved the staff recommendation to issue renewals on 3 Theory Wellness Incorporated licenses, subject to the additional condition requested by Commissioner Camargo by a vote of 5 in favor. Commissioners Camargo, Concepcion, Roy, Stebbins, and Hoffman with none opposed. Thank you. The next roster I'd like the commission to consider are the remaining adult use renewals that were not covered by the 2 previous votes. So let me just be explicit. On this roster, A through H and L through Z. I am not aware of any requests for additional conditions on these licenses, but can I ask, are there questions, comments, or requests for additional conditions on these renewal applications? Then could I ask Commissioner Stebbins, would you please make a motion to approve the staff recommendation, issue renewals to the licensees on the roster I just articulated?
So moved.
Thank you. Commissioner Camargo, could I ask you to second that motion, please?
Second.
Thank you. Let's record show that Commissioner Stebbins made the motion to approve, seconded by Commissioner Camargo. Commissioner Camargo, your vote, please.
Aye.
Thank you. Commissioner Concepcion.
Aye.
Thank you. Commissioner Roy.
Aye.
Thank you. Commissioner Stebbins.
Aye.
Thank you. Let the record show, Commissioner Hoffman, aye. Let the record show that the commission approved the staff recommendation to issue renewals to the aforementioned roster by a vote of 5 in favor. Commissioners Camargo, Concepcion, Roy, Stebbins, and Hoffman with none opposed. The next roster with respect to renewals I'd like the commission to consider is, if you could go please to the following slide, please, Matt. Thank you. Are for the following set of MTCs and RMDs. I am not aware of requests from any commissioner for additional conditions on these licenses, but before I ask for a motion, are there any questions, comments, or requests for additional conditions on these renewals? Then could I ask Commissioner Camargo, could you please make a motion to approve the staff recommendation to issue renewals to the roster of the medical entities that are on this slide?
So moved.
Thank you. So it's just to be explicit, it's DD through TT. Thank you very much, Commissioner Camargo. Commissioner Concepcion, could I have a second, please?
Second.
Thank you. Let's make sure that Commissioner Camargo made the motion to approve, seconded by Commissioner Concepcion. Commissioner Camargo, your vote, please.
Aye.
Thank you, Commissioner Concepcion.
Aye.
Thank you, Commissioner Roy.
Aye.
Thank you, Commissioner Stebbins.
Aye.
Thank you, Commissioner Hoffman. Aye. Let the record show the commission approved the staff recommendation to issue renewals to the licensees on this roster by a vote of 5 in favor. Commissioners Camargo, Concepcion, Roy, Stebbins, and Hoffman with none opposed. Ms. Defoe, are there any other applications for renewals to be considered by the commission at this point in time?
Yes, sir.
Okay, thank you very much. Then let's move on to the next set of license discussions and decisions, which are final licenses. Please go ahead, Ms. Defoe.
So we have 9 adult use final licenses and 1 MTC. All facilities have been inspected and found to be in full compliance with the commission's regulations.
Thank you very much. Again, I am unaware of any requests for additional conditions on these licenses, but are there any questions or comments or requests for additional conditions before I ask for a vote? So I think I've lost track of where I am, but I think Commissioner Concepcion, if you wouldn't mind making a motion to approve the staff recommendation to issue final licenses to the licensees on this roster.
So moved.
Thank you very much. Commissioner Roy, would you second that motion?
Second.
Thank you. Let the record show that Commissioner Concepcion made the motion to approve, seconded by Commissioner Roy. Commissioner Camargo, your vote, please.
Aye.
Thank you. Commissioner Concepcion.
Aye.
Thank you. Commissioner Roy.
Aye.
Thank you. Commissioner Stebbins.
Aye.
Thank you. Commissioner Hoffman, aye. Let the record show that the commission accepted the staff recommendation to issue final licenses to the applicants on this roster by a vote of 5 in favor. Commissioners Camargo, Concepcion, Roy, Stebbins, and Hoffman with none opposed. Thank you. Are there any other final licenses for the commission to be considering at this point in time, Ms. Defoe?
No, sir.
Okay, then let's get into the fun part of this and let's do provisionals. If you just give me 1 second to just gather up my notes. Okay, let's start off with 617 Therapeutics Healthcare Incorporated, which is applying for a retail license. Please go ahead, Ms. Defoe.
Yep, the applicant here is 617 Therapeutic Healthcare Incorporated. The proposed location is 144 Bowdoin Street, located in Boston. They're seeking a retail license. The applicant received general review. Additional information is contained within the executive summary for the Commission's review and consideration. Therefore, Commission staff do recommend the issuance of a provisional license subject to the conditions before you.
Thank you very much, Ms. Defoe. I have requests from Commissioners Stebbins and Roy for additional conditions on this license from Commissioner Roy. Prior to final application for licensure, please provide the Commission with an update of your proposed creation of a 501c3 charitable nonprofit as stated in your positive impact plan, namely under program section 3, to include the name of said nonprofit, board members, EIN number, articles of incorporation, and mission statement. From Commissioner Stebbins, 2 additional conditions that he's requested. First, upon organization of proposed nonprofit organization, applicant will provide charter documentation and confirmation on letterhead. The organization will receive donations. That seems to be, while it's related to Commissioner Roy's condition, add some additional requests. So I think we should include both conditions. Is that acceptable, Commissioner Stebbins?
That's fine.
Okay, and then the second condition requested by Commissioner Stebbins, prior to final application for licensure, contact CCC Licensing Division for an update to confirm your training and recruitment partners' eligibility to support your activities. Are there other conditions requested, questions or comments on this application before I ask for a motion?
Mr. Chair, just a quick point. After we wrap up discussion on this application, there were some comments I wanted to make about the provisional license group as a whole. I forgot to mention that in advance, but
okay, that's fine. I'll let's go through the vote as you suggested, and then I'll certainly give you the opportunity to make your comments. Is that all right?
It's fine. Thank you.
Okay, sure, no problem. Let me ask Commissioner Roy, would you please make a motion to approve the staff recommendation, issue a provisional license to 617 Therapeutics Healthcare Incorporated, subject to the additional conditions requested by Commissioners Stebbins and Roy?
So moved.
Thank you. Commissioner Stebbins, would you second that vote, please? Or second that motion, please?
Second.
Thank you. Let the record show that Commissioner Roy made the motion, seconded by Commissioner Stebbins. Commissioner Camargo, your vote, please.
Aye.
Thank you. Commissioner Concepcion?
Aye.
Thank you. Commissioner Roy?
Aye.
Thank you. Commissioner Stebbins?
Aye.
Thank you. Commissioner Hoffman, aye. Let the record show the Commission approves the staff recommendation to issue a provisional license to 617 Therapeutics Healthcare Incorporated, subject to the additional conditions requested by Commissioner Stebbins and Roy by a vote of 5 in favor. Commissioners Camargo, Concepcion, Roy, Stebbins, and Hoffman with none opposed. Thank you. Before we get into the next one, then please go ahead, Commissioner Stebbins.
Sure. Thank you, Mr. Chair. I appreciate the indulgence on this. I know I've raised this issue in the past, but I have to say I was less than encouraged when I found a number of our provisional applicants had pretty much the same diversity plan incorporated into their application this month, and others had similar positive impact plans. I know that our applicants are aware of the strong intent of this statute to promote social equity and diversity. So it is disappointing to read similar plans from applicants, in one case, applicants who are at complete opposite ends of the Commonwealth. Our applicants come from a variety of impressive backgrounds and strong professional experience among the folks that are going to be leading these licensees. So I have to say it's surprising that then they would allow a kind of standard cookie cutter plan to become part of their application. It does not give me confidence that they will have the will or the interest to pursue their plan's objectives. And as we've seen from Commissioner Camargo, you know, I hope I can be proven wrong when we see the results at renewal time. I understand this is not an easy process to license a marijuana business. It involves a lot of work, a lot of sacrifice, and interestingly, when I review other parts of their application, our applicants can convey a strong awareness of their host community. As we all know, Commissioner Camargo, myself, and members of our CCC team updated our diversity plan guidance to help applicants find the tools, the ideas, and recommendations to meet the commission's expectations. So our hope is that meeting our expectations positions them for success, and we'll continue to see a lot of evolution in some of these plans and future applications. But for the time being, I just wanted to raise my concern, and hopefully we'll keep focused on some of these applicants when it comes around to renewal time at the appropriate point. Thank you.
Thank you very much, Commissioner Stebbins. Any comments on in addition to what Commissioner Stebbins just went through? Commissioner Roy?
I just want to thank Commissioner Stebbins for that observation. I noticed it too, boilerplate language, and I agree with his sentiment that there's not one size fits all. Different communities have different needs, and we do look for that in these positive impact plans. Thank you.
Thank you. Any other comments before we move on? Then let's move on, please. The next applicant is 620 Industries Incorporated. Ms. Defoe.
The applicant here is 620 Industries Incorporated. The proposed location is 620 Bolu Street, located in Holyoke. They are seeking a cultivation tier 1 indoor license. The applicant received expedited review as a social equity participant. Additional information is contained within the executive summary for the Commission's review and consideration. Therefore, Commission staff do recommend the issuance of a provisional license subject to the conditions before you.
Thank you, Ms. Defoe. I have requests from both Commissioners Roy and Stebbins for additional conditions on this application, starting with Commissioner Roy. Specifically, prior to final application for licensure, please update diversity plan under program section, namely bullet 1, to also include veterans publications and job sites and other veteran outreach strategies when advertising employment opportunities. And then from Commissioner Stebbins, his additional requested condition is specifically prior to final application for licensures, verify that diversity hiring goals are intended to be the same as diverse spending goals. Are there any other questions or comments or requests for additional conditions on this application? Yes, go ahead, Commissioner Roy.
I just want to make a comment that my consideration when I place this condition is to help them attain their goal, which is admirable. 15% veterans is a really admirable goal. And when you list the publications, and I see this quite often, is zero outreach to veteran job sites or outreach. So my concern is without that, they wouldn't be able to attain this goal. So and that's why my mindset when I put this condition on the license. Thank you.
Thank you. Any other comments or questions or requests for additional conditions? Then Commissioner Stebbins, could I please ask for a motion to approve the staff recommendation, issue a provisional license to 620 Industries Incorporated, subject to the additional conditions requested by Commissioner Stebbins and Roy?
So moved.
Thank you. Commissioner Camargo, would you second that motion, please?
Second.
Thank you. Let the record show that Commissioner Stebbins made the motion, seconded by Commissioner Camargo. Commissioner Camargo, your vote, please.
Aye.
Thank you. Commissioner Concepcion.
Aye.
Thank you. Commissioner Roy.
Aye.
Thank you. Commissioner Stebbins.
Aye.
Thank you. Commissioner Hoffman, aye. Let the record show that the commission approved the staff recommendation, issue a provisional license to 620 Industries Incorporated, subject to the additional conditions requested by Commissioner Stebbins and Roy by a vote of 5 in favor. Commissioners Camargo, Concepcion, Roy, Stebbins, and Hoffman with none opposed. Thank you. Next up, Ms. Defoe, East Boston Local Roots LLC, which is applying for a retail license. Please go ahead.
Yes. The applicant here is East Boston Local Roots LLC. The proposed location is 1006 Bennington Street, located in Boston. They're seeking a retail license, and the applicant received a general review. Additional information is contained within the executive summary for the Commission's review and consideration. Therefore, Commission staff do recommend the issuance of a provisional license subject to the conditions before you.
Okay, thank you, Ms. Defoe. I have a request from Commissioner Stebbins for 2 additional conditions on this license. First, prior to final application for licensure, identify additional sources for promoting opportunities and recruiting diverse employee base. And then second, prior to final application for licensures, review diversity hiring goals based on statistics of community and region, not just on overall state statistics. Are there any comments, questions, or requests for additional conditions in this license before I ask for a motion? Then Commissioner Camargo, could I please ask you to make a motion to approve the staff recommendation to issue a provisional license to East Boston Local Routes LLC, subject to the additional conditions requested by Commissioner Stebbins?
So moved.
Thank you. Commissioner Concepcion, would you second that motion, please?
Second.
Thank you. Let's make sure that Commissioner Camargo made the motion to approve, seconded by Commissioner Concepcion. Commissioner Camargo, your vote, please.
Aye.
Thank you, Commissioner Concepcion.
Aye.
Thank you, Commissioner Roy.
Aye.
Thank you, Commissioner Stebbins.
Aye.
Thank you, Commissioner Hoffman. Aye. Let the record show the commission approved the staff recommendation to issue a provisional license to East Boston Local Routes LLC, subject to the additional conditions requested by Commissioner Stebbins, by a vote of 5 in favor, Commissioners Camargo, Concepcion, Roy, Stebbins, and Hoffman, with none opposed. Thank you. The next, in my understanding, Ms. Defoe, is that the two Faded LLC applications are not co-located, so we'll consider them separately. Is that correct?
That's correct.
Thank you. So let's start with the first Faded LLC, which is applying for a product manufacturing license. This has been expedited as the applicant is a social equity program participant. Please go ahead, Ms. Defoe.
The applicant here is Faded LLC, doing business as Your Green Package. The proposed location is 488 Stafford Street, located in Leicester. They're seeking a product manufacturing license, and the applicant did receive expedited review as a social equity participant. Additional information is contained within the executive summary for the commission's review and consideration. Therefore, commission staff do recommend the issuance of a provisional license subject to the conditions before you.
Thank you very much. I have a request from Commissioner Stebbins on this particular license application. Specifically, his request for additional condition is as follows: prior to final application for licensure, review positive impact plan and any strategy for outreach to residents of nearby disproportionate impact designated communities of Worcester and Spencer for employment, and provide any update. My understanding, Commissioner Stebbins, is that your proposed additional condition applies only to the product manufacturing application. Is that correct?
That's correct.
Thank you. Are there any other questions, comments, or requests for additional conditions on this license? Then could I ask, please, Commissioner Concepcion, would you make a motion to approve the staff recommendation to issue a provisional license to Faded LLC for product manufacturing, subject to the additional condition requested by Commissioner Stebbins?
So moved.
Thank you. Commissioner Roy, could I ask you to second that motion, please?
Second.
Thank you. Let's make sure the Commissioner Concepcion made the motion to approve, seconded by Commissioner Roy. Commissioner Camargo, your vote, please.
Aye.
Thank you. Commissioner Concepcion.
Aye.
Thank you. Commissioner Roy.
Aye.
Thank you. Commissioner Stebbins.
Aye.
Thank you. Commissioner Hoffman, aye. Let the record show that the commission approved the staff recommendation to issue a provisional license to Faded LLC for product manufacturing, subject to the additional condition requested by Commissioner Stebbins, by a vote of 5 in favor, Commissioners Camargo, Concepcion, Roy, Stebbins, and Hoffman, with none opposed. Next up is a second provisional license application from Faded LLC, this one for being a transporter with other medical, ME license. Please go ahead, Ms. Defoe.
All right, the applicant here is Faded LLC, doing business as Your Green Package. The proposed location is 190 Farm Street, Suite B, located in Bellingham. They're seeking a transporter with other ME licenses. The applicant received expedited review as a social equity participant. Additional information is contained within the executive summary for the commission's review and consideration. Therefore, commission staff do recommend the issuance of a provisional license subject to the conditions before you.
Thank you very much. I am not aware of any requests for additional conditions on this license application. Are there questions, comments, or requests for additional conditions? Then could I ask Commissioner Roy, would you please make a motion to approve the staff recommendation to issue a provisional license to Faded LLC as a transporter with other ME license? If you could make that motion, please.
So moved.
Thank you. Commissioner Stebbins, would you second that motion, please?
Second.
Thank you. Let the record show that Commissioner Roy made the motion, seconded by Commissioner Stebbins. Commissioner Camargo, your vote, please.
Aye.
Thank you. Commissioner Concepcion.
Aye.
Thank you. Commissioner Roy.
Aye.
Thank you. Commissioner Stebbins.
Aye.
Thank you. Commissioner Hoffman, aye. Let the record show the commission approved the staff recommendation to issue a provisional license to Faded LLC as a transporter with other ME license by a vote of 5 in favor, Commissioners Camargo, Concepcion, Roy, Stebbins, and Hoffman with none opposed. Thank you. Next up is Fish Road LLC, which is applying for a Tier 6 indoor cultivation license. Please go ahead, Ms. Defoe.
The applicant here is Fish Road LLC. The proposed location is 40 Fish Road, located in Dudley. They're seeking a cultivation Tier 6 indoor license. The applicant received general review. Additional information is contained within the executive summary for the Commission's review and consideration. Therefore, Commission staff do recommend the issuance of a provisional license subject to the conditions before you.
Thank you very much, Ms. Defoe. I have a request from Commissioner Camargo for an additional condition on this license. Specifically, prior to final licensure, applicant to resubmit their positive impact plan to include more than hiring, and that, quote, promotes and encourages full participation in the regulated cannabis industry by individuals from communities disproportionately harmed by cannabis prohibition and enforcement, and to positively impact those communities under MGL Chapter 94G, Section 4 in Massachusetts. Are there any other requests for additional conditions or questions or comments on this application? Then could I ask Commissioner Stebbins, would you please make a motion to approve the staff recommendation to issue a provisional license to Fish Road LLC, subject to the additional condition requested by Commissioner Camargo?
So moved.
Thank you. Commissioner Camargo, would you second that motion, please?
Second.
Thank you. Let the record show that that the motion was made by Commissioner Stebbins, seconded by Commissioner Camargo. Commissioner Camargo, your vote, please.
Aye.
Thank you. Commissioner Concepcion.
Aye.
Thank you. Commissioner Roy.
Aye.
Thank you. Commissioner Stebbins.
Aye.
Thank you. Commissioner Hoffman, I let the record show the Commission approve the staff recommendation to issue a provisional license to Fish Road LLC, subject to the additional condition requested by Commissioner Camargo by a vote of 5 in favor. Commissioners Camargo, Concepcion, Roy, Stebbins, and Hoffman with none opposed. Next up, we have 2 license applications from Forest Wild LLC. These are co-located, if I am correct, Ms. Defoe?
Yes, they are co-located.
Sorry about that. And both of these, if I'm correct, were expedited based upon their status as a woman-owned business. If you could please go ahead with your summary on the 2 of these. Thank you.
The applicant here is Forest Wild LLC. The proposed location is 635 Laurel Street, located in Lee. They are seeking a product manufacturing and a retail license. The applicant received expedited review as a woman-owned business. Additional information is contained within the executive summary for the Commission's review and consideration. Therefore, Commission staff do recommend the issuance of a provisional license subject to the conditions before you.
Thank you very much, Ms. Defoe. I am aware of a additional condition requested by Commissioner Stebbins on the first of these licenses, which is the product manufacturing license. Specifically, the additional condition requested by Commissioner Stebbins is prior to final application for licensure, review diversity hiring goals based upon statistics of community and region, and not just based on overall state statistics. Commissioner Camargo, I know that you have requested a condition on the second of these the Forest Wild applications, but you do not have an additional condition requested on the first. Is that correct?
Give me 1 second. Let me just see.
Sure.
You can add both, Chairman.
Okay, that's fine. So I've read the additional condition requested by Commissioner Stebbins. Let me add the additional condition requested by Commissioner Camargo. Specifically, prior to final licensure, applicant to submit additional information for goal number 2 of their positive impact plan, clarify location of workshops and how many workshops they plan to conduct, and if any community outreach besides advertisement on the Berkshire Eagle is intended. Are there any additional conditions being requested on this application, or any other questions or comments? Once again, I'm not sure I'm still in the right place, so I apologize if I'm duplicating this, but Commissioner Stebbins, I think actually Commissioner Camargo, would you please make the following motion to approve the staff recommendation to issue a provisional license to Forest Wild LLC for product manufacturing, subject to the additional conditions requested by Commissioners Stebbins and Camargo?
So moved.
Thank you. Commissioner Concepcion, would you second that motion, please?
Second.
Thank you. Let the record show that Commissioner Camargo made the motion, seconded by Commissioner Concepcion. Commissioner Camargo, your vote, please.
Aye.
Thank you. Commissioner Concepcion.
Aye.
Thank you. Commissioner Roy.
Aye.
Thank you. Commissioner Stebbins.
Aye.
Thank you. Commissioner Hoffman, aye. Let the record show the commission approve the staff recommendation to issue a provisional license to Forest Wild LLC for product manufacturing, subject to the additional conditions requested by Commissioners Stebbins and Camargo. By a vote of 5 in favor, Commissioners Camargo, Concepcion, Roy, Stebbins, and Hoffman with none opposed. Thank you. Next up, could I ask please for a motion to approve staff recommendation to issue a provisional license to Forest Wild LLC for retail, subject to the additional conditions requested by Commissioner Stebbins and Camargo, which are the identical conditions that were mentioned on the previous application. Could I have such a motion, please, Commissioner Concepcion?
So moved.
Thank you. Commissioner Roy, would you second that motion, please?
Second.
Thank you. Let's make sure that Commissioner Concepcion made the motion to approve, seconded by Commissioner Roy. Commissioner Camargo, your vote, please.
Aye.
Thank you. Commissioner Concepcion.
Aye.
Thank you. Commissioner Roy.
Aye.
Thank you. Commissioner Concepcion. Oh, I'm sorry. Commissioner Stebbins.
Aye.
Thank you. Commissioner Hoffman, aye. Let the record show the commission approve the staff recommendation to issue a provisional license to Forest Wild LLC for retail, subject to the additional conditions requested by Commissioner Stebbins and Camargo. By a vote of 5 in favor, Commissioners Camargo, Concepcion, Roy, Stebbins, and Hoffman with none opposed. Thank you. Next up is Green Grab Incorporated. I will say this is, I believe, our first provisional license application for a delivery operator, a significant accomplishment or milestone for the commission, and one that I hope is the first of many. So let's go ahead with this. This obviously, because we are talking about a delivery operator license, by definition, the applicant has to be either an economic empowerment or social equity applicant. This is a social equity program applicant. Please go ahead, Ms. Defoe.
The applicant here is Green Grab Incorporated. The proposed location is 620 Beaulieu Street, located in Holyoke. They're seeking a marijuana delivery operator license. The applicant received expedited review as a social equity participant. Additional information is contained within the executive summary for the commission's review and consideration. Therefore, commission staff do recommend the issuance of a provisional license subject to the conditions before you.
Thank you very much, Ms. Defoe. I have a request from Commissioner Roy to add an additional condition to this application, specifically prior to final application for licensure. Please update diversity plan under program section, namely bullet 1, to also include veteran publications, job sites, and other veteran outreach strategies when advertising employment opportunities. Are there other questions, comments, or requests for additional conditions on this license? Then could I ask please for a motion, Commissioner Roy, to approve the staff recommendation to issue a provisional license to Green Grab Incorporated, subject to the additional condition requested by Commissioner Roy?
So moved.
Thank you. Commissioner Stebbins, would you second that motion, please?
Second.
Thank you. Let's record that Commissioner Roy made the motion, seconded by Commissioner Stebbins. Commissioner Camargo, your vote, please.
Aye.
Thank you. Commissioner Concepcion.
Aye.
Thank you. Commissioner Roy.
Aye.
Thank you. Commissioner Stebbins.
Aye.
Thank you. Commissioner Hoffman, aye. Let the record show that the commission approve the staff recommendation to issue a provisional license to Green Grab Incorporated, subject to the additional condition requested by Commissioner Roy by a vote of 5 in favor. Commissioners Camargo, Concepcion, Roy, Stebbins, and Hoffman with none opposed. And once again, let's just take a moment to celebrate this milestone and hope it's the first of many. Good luck. I thought you were about to break into song, Commissioner Camargo.
No. I just, we needed a little bit of dance, little celebration, so we can make it to the end and celebrate this license.
Great. Thank you very much. Next up, Ms. Defoe, Hydration LLC.
Yes, the applicant here is Hydration LLC. The proposed location is 20 Payton Street, located in Lowell. They're seeking a product manufacturing license and they received general review. Additional information is contained within the executive summary for the commission's review and consideration. Therefore, commission staff do recommend the issuance of a provisional license subject to the conditions before you.
Thank you very much, Ms. Defoe. I have a request from Commissioner Stebbins to add an additional condition to this license, specifically prior to final application for licensure, consider a goal for a positive impact plan with a focus on employment opportunities for disproportionate impact community of Lowell. Are there any other questions, comments, or requests for additional conditions on this license? Then I think we're up to you, Commissioner Stebbins. If you please could make a motion to approve the staff recommendation to issue a provisional license to Hydration LLC, subject to the additional condition requested by Commissioner Stebbins.
So moved.
Thank you. Commissioner Camargo, would you second that motion, please?
Second.
Thank you. Let the record show that Commissioner Stebbins made the motion to approve, seconded by Commissioner Camargo. Commissioner Camargo, your vote, please.
Aye.
Thank you. Commissioner Concepcion.
Aye.
Thank you, Commissioner Roy.
Aye.
Thank you, Commissioner Stebbins.
Aye.
Thank you, Commissioner Hoffman. Aye. Let the record show the commission approve the staff recommendation to issue a provisional license to Hydration LLC, subject to the additional condition requested by Commissioner Stebbins by a vote of 5 in favor. Commissioners Camargo, Concepcion, Roy, Stebbins, and Hoffman with none opposed. Thank you. Next up, please, Ms. Defoe, Highmark Provisions LLC.
Yes, the applicant here is Highmark Provisions LLC. The proposed location is 201 Summer Street, located in Holliston. They are seeking a cultivation Tier 2 indoor license, and the applicant received a general review. Additional information is contained within the executive summary for the commission's review and consideration. Therefore, commission staff do recommend the issuance of a provisional license subject to the conditions before you.
Thank you very much, Ms. Defoe. I have a request from Commissioner Roy for an additional condition on this license, specifically prior to final application for licensures, please update diversity plan, namely Goal 1, hiring and diversity, paragraph 2 under bullet 5, to also include veterans publications and job sites and other veteran outreach strategies when advertising employment opportunities. Are there other questions, comments, or requests for additional conditions on this license application? Go ahead, Commissioner Roy.
If I just may add a comment, thank you very much,
Absolutely.
Mr. Chairman. That, again, another admirable goal, 10% of veteran hires. And, at the commission, we celebrate diversity. They have a great plan. But when listing, and I'm seeing this listing their publications that they're going to advertise employment opportunities, I'm not seeing any veterans outreach when they list their diverse publications. Again, we celebrate that. We celebrate that they're listing in diverse publications, but I'm not seeing any veteran outreach, and I just concerns me how you'll attain that goal of 10% without any list in your plan on how to do so. Thank you so much.
Thank you. Any other questions or comments or requests for additional conditions on this application? Then could I ask Commissioner Roy, would you please make a motion to approve the staff recommendation to issue a provisional license to Highmark Provision LLC, subject to the additional condition requested by Commissioner Roy?
So moved.
Thank you. Commissioner Stebbins, would you second that motion, please?
Second.
Thank you. Let the record show that Commissioner Roy made the motion, seconded by Commissioner Stebbins. Commissioner Camargo, your vote, please. I'm sorry, I didn't hear that.
Aye.
Thank you. Commissioner Concepcion?
Aye.
Thank you. Commissioner Roy?
Aye.
Thank you. Commissioner Stebbins?
Aye.
Thank you. Commissioner Hoffman, aye. Let the record show that the commission approve the staff recommendation to issue a provisional license to Highmark Provisions LLC, subject to the additional condition requested by Commissioner Roy by a vote of 5 in favor. Commissioners Camargo, Concepcion, Roy, Stebbins, and Hoffman with none opposed. Thank you. Next up, Ms. Defoe, is KG Collective Brockton applying for a retail license, and this is an economic empowerment applicant, if I'm correct.
They are.
Thank you. Please go ahead.
The applicant here is KG Collective Brockton. The proposed location is 912 Crescent Street, located in Brockton. They are seeking a retail license. The applicant received priority review as an economic empowerment applicant. Additional information is contained within the executive summary for the commission's review and consideration. Therefore, commission staff do recommend the issuance of a provisional license subject to the conditions before you.
Thank you very much, Ms. Defoe. I have a request from Commissioner Stebbins for an additional condition on this license. Specifically, prior to final application for licensure, contact CCC Licensing Division for an update to confirm your training and recruitment partners' eligibility to support your activities. Are there any other questions, comments, or requests for additional conditions on this application?
I do have a request
Yes.
for an additional condition.
Okay, please go ahead.
Thank you. So prior to final application for licensure, provide additional information on how 2 security guards will be utilized during the prescribed 12 hours per day, 7-day per week schedule.
Thank you. Can you just do me a favor, Commissioner Concepcion? Could you submit to Christopher Smith that in writing, so just it'll get into our minutes appropriately?
Yes, will do.
Thank you. Are there any other requests for conditions or questions or comments on this? Then Commissioner Stebbins, would you please make a motion to approve the staff recommendation to issue a provisional license to KG Collective Brockton, subject to the additional conditions requested by Commissioner Stebbins and Concepcion?
So moved.
Thank you. Commissioner Camargo, would you second that motion, please?
Second.
Thank you. Let the record show that Commissioner Stebbins made the motion, seconded by Commissioner Camargo. Commissioner Camargo, your vote, please.
Aye.
Thank you, Commissioner Concepcion.
Aye.
Thank you, Commissioner Roy.
Aye.
Thank you, Commissioner Stebbins.
Aye.
Thank you, Commissioner Hoffman. Aye. Let the record show that the commission approves the staff recommendation to issue a provisional license to KG Collective Brockton, subject to the additional conditions requested by Commissioner Stebbins and Concepcion by a vote of 5 in favor. Commissioners Camargo, Concepcion, Roy, Stebbins, and Hoffman with none opposed. Thank you. Next up is Massachusetts Green Retail Incorporated applying for a retail license. Please go ahead, Ms. Defoe.
The applicant here is Massachusetts Green Retail Incorporated. The proposed location is 829 Boston Street, located in Lynn. They are seeking a retail license and receive general review. Additional information is contained within the executive summary for the commission's review and consideration. Therefore, commission staff do recommend the issuance of a provisional license subject to the conditions before you.
Thank you very much. I am not aware of any requests for an additional condition on this license, but are there comments, questions, or requests for additional conditions? Okay, then Commissioner Camargo, could I ask you please to make a motion to approve the staff recommendation to issue a provisional license to Massachusetts Green Retail Incorporated?
So moved.
Thank you. Commissioner Concepcion, would you second that motion, please? I'm sorry? Thank you. Let the record show that Commissioner Camargo made the motion to approve, seconded by Commissioner Concepcion. Commissioner Camargo, your vote, please.
Aye.
Thank you. Commissioner Concepcion.
Aye.
Thank you. Commissioner Roy.
Aye.
Thank you. Commissioner Stebbins.
Aye.
Thank you. Commissioner Hoffman. Aye. Let the record show that the commission approve the staff recommendation to issue a provisional license to Massachusetts Green Retail Incorporated by a vote of 5 in favor. Commissioners Camargo, Concepcion, Roy, Stebbins, and Hoffman with none opposed. Thank you. Next up, we have 2 applications from Standish Green Group LLC. These are co-located, if I'm correct, Ms. Defoe?
Yes, sir.
Thank you. Please go ahead then.
The applicant here is Standish Green Group LLC. The proposed location is 663 Lawrence Street, located in Lowell. They are seeking a cultivation tier 3 indoor and product manufacturing license and receive general review. Additional information is contained within the executive summary for the commission's review and consideration. Therefore, commission staff do recommend the issuance of a provisional license subject to the conditions before you.
Thank you very much, Ms. Defoe. We'll then vote separately on these 2 applications, starting with the first, which is for cultivation tier 3 indoor. I have requests from both Commissioner Roy and Commissioner Camargo for additional conditions on this license, starting with Commissioner Roy. Specifically, prior to final application for licensure, please update diversity plan under program section, namely bullet 1, to also include veterans publications and job sites and other veteran outreach strategies when advertising employment opportunities. From Commissioner Camargo, her additional requested condition is prior to final licensure, applicant to submit additional information on what, if any, community outreach will be conducted besides advertisement in the Lowell Sun as part of their positive impact plan programs. Are there any additional conditions requested on this license, or any questions or comments before I ask for a motion? Then could I ask, I think I'm at Commissioner Concepcion, if that's okay, could I ask you please, Commissioner Concepcion, to make a motion to approve the staff recommendation to issue a provisional license to Standish Green Group LLC for tier 3 indoor cultivation, subject to the additional conditions requested by Commissioners Camargo and Roy?
So moved.
Thank you. Commissioner Roy, could I ask you to second that motion?
Second.
Thank you. Let's make sure that Commissioner Concepcion made the motion, seconded by Commissioner Roy. Commissioner Camargo, your vote, please.
Aye.
Thank you, Commissioner Concepcion.
Aye.
Thank you, Commissioner Roy.
Aye.
Thank you, Commissioner Stebbins.
Aye.
Thank you, Commissioner Hoffman. Aye. Let the record show the commission approve the staff recommendation to issue a provisional license to Standish Green Group LLC for tier 3 indoor cultivation, subject to the additional conditions requested by Commissioners Camargo and Roy by a vote of 5 in favor. Commissioners Camargo, Concepcion, Roy, Stebbins, and Hoffman with none opposed. Thank you. Next, I would ask the commission to consider the second Standish Green Group application for product manufacturing, subject, and just please correct me if I'm wrong, to the identical conditions requested by Commissioners Camargo and Roy. Is that correct?
Correct.
Correct.
Thank you. Then could I ask Commissioner Roy, would you please make the motion to approve the staff recommendation to issue a provisional license to Standish Green Group LLC, subject to the additional conditions requested by Commissioners Camargo and Roy?
So moved.
Thank you. Commissioner Stebbins, would you second that motion, please?
Second.
Thank you. Let the record show that Commissioner Roy made the motion, seconded by Commissioner Stebbins. Commissioner Camargo, your vote, please.
Aye.
Thank you. Commissioner Concepcion.
Aye.
Thank you. Commissioner Roy.
Aye.
Thank you. Commissioner Stebbins.
Aye.
Thank you. Commissioner Hoffman, I'll let the record show the commission approve the staff recommendation to issue a provisional license to Standish Green Group LLC for product manufacturing, subject to the additional conditions requested by Commissioners Camargo and Roy by a vote of 5 in favor. Commissioners Camargo, Concepcion, Roy, Stebbins, and Hoffman with none opposed. Thank you. Next up is the Green Lady Dispensary 2 Incorporated for retail. If I am correct, this was expedited based upon the status as a minority-owned business. Please go ahead, Ms. Defoe.
The applicant here is the Green Lady Dispensary 2 Incorporated. The proposed location is 740 Beacon Street, located in Newton. They are seeking a retail license and received expedited review as a minority-owned business. Additional information is contained within the executive summary for the Commission's review and consideration. Therefore, Commission staff do recommend the issuance of a provisional license subject to the conditions before you.
Thank you very much. I have a request from Commissioner Roy for an additional condition on this license, specifically consumer education compliance condition. Prior to final licensure and upon receiving a commence operations notice, the applicant shall ensure full compliance with all consumer education material requirements applicable to its license type in accordance with 935 CMR 500.140 Section 6, which will include the addition of current omitted sections C, D, E, F, G, and J. Any comments on that, Commissioner Roy? Or
Yes, I just, I want to commend them, but for having consumer education, but 100% compliance means, having all the sections. So I noticed that they had omitted sections C, D, E, F, G, and J.
okay, thank you. Any other comments or questions or requests for additional conditions on this application? Then Commissioner Stebbins, could I ask you please for a motion to approve the staff recommendation to issue a provisional license to the Green Lady Dispensary 2 Incorporated, subject to the additional condition requested by Commissioner Roy?
So moved.
Thank you. Commissioner Camargo, could I ask you to second that motion, please?
Second.
Thank you. Let's make sure that Commissioner Stebbins made the motion, seconded by Commissioner Camargo. Commissioner Camargo, your vote, please.
Aye.
Thank you. Commissioner Concepcion.
Aye.
Thank you, Commissioner Roy.
Aye.
Thank you, Commissioner Stebbins.
Aye.
Thank you, Commissioner Hoffman. Aye. Let the record show that the commission approved the staff recommendation to issue a provisional license to the Green Lady Dispensary 2 Incorporated, subject to the additional condition requested by Commissioner Roy by a vote of 5 in favor. Commissioners Camargo, Concepcion, Roy, Stebbins, and Hoffman with none opposed. Thank you. Next up, we have Wiseman Genetics LLC, which is a microbusiness and therefore was expedited based upon the type of application. Please go ahead, Ms. Defoe.
The applicant here is Wiseman Genetics LLC. The proposed location is 370 Wareham Road, Lot 2A, Building 4, Unit A, located in Middleborough. They are seeking a microbusiness cultivation license, and they did receive expedited review based on their license type. Additional information is contained within the executive summary for the Commission's review and consideration. Therefore, Commission staff do recommend the issuance of a provisional license subject to the conditions before you.
Thank you very much, Ms. Defoe. I have requests from both Commissioner Stebbins and Camargo for an additional condition on this license. First from Commissioner Camargo. Prior to final licensure, applicant to submit a partnership letter from Project New Hope in Worcester to provide donations to support veterans and their families. And then from Commissioner Stebbins, prior to final application for licensure, identify purpose and goal of donation to Project New Hope. Are those the same, or would you like both conditions, Commissioner Stebbins and Camargo?
Mr. Chair, if I could ask you to read Commissioner Camargo's
Sure.
motion.
I'll try not to do it with my New York speed. So Commissioner Camargo's request was prior to final licensure, applicant to submit a partnership letter from Project New Hope in Worcester to provide donations to support veterans and their families.
Okay, if it's okay, I would also indulge you to keep my condition
Sure.
as well.
No, it's your call. Commissioner Camargo, are you okay with that?
Absolutely, it's two different
Okay.
things.
Great. Then are there other questions or comments or requests for additional conditions on this application? Then Commissioner Camargo, please, could I ask you to make a motion to approve the staff recommendation, issue a provisional license to Wiseman Genetics LLC, subject to the additional conditions requested by Commissioner Stebbins and Camargo?
Second.
No,
No.
I make the motion,
So
please.
moved. So
Thank you.
moved. Sorry,
Thank you.
I am somewhere.
Commissioner Concepcion, I know that Commissioner Camargo tried to steal this from you, but would you make the second, please?
Second, and I know this is a little bit out of unorthodox right now, but I need to run outside and move my car. It's getting towed. So I'm just gonna run
okay,
out, move it, and I'll be back.
We're gonna can we take a break? Let's use this opportunity to take a break for a half hour.
Well, I know we have to finish this vote, so finish, I think we still have a quorum if I'm running outside, but I have to move it because I'm literally outside.
Okay, we made the motion by Camargo, seconded by Commissioner Concepcion. Commissioner Concepcion, what's your vote, please?
Aye.
Go. Commissioner Camargo, your vote, please.
Aye.
Thank you. Commissioner Roy?
Aye.
Thank you. Commissioner Stebbins?
Aye.
Thank you. Commissioner Hoffman, I let the record show the commission approves the staff recommendation to issue a provisional license to Wiseman Genetics LLC, subject to the additional conditions requested by Commissioner Stebbins and Camargo by a vote of 5 in favor. Commissioners Camargo, Concepcion, Roy, Stebbins, and Hoffman, with none opposed. Ms. Defoe, are there any other provisional licenses that are up for commission consideration at this point in time?
No, sir.
So, well, once again, my thanks to you, to the entire licensing team for your hard work, and really appreciate you spending the time with us today. I hope you'll come back next month.
I will be here, and thank you to you and all the commissioners.
Thanks very much. So I think we're going to take advantage of the misfortune that Commissioner Concepcion is experiencing and take a lunch break, if that's okay with everybody. It's 12:42. Can I suggest that we reconvene at 1:15? 33 minutes. Is that enough for everybody to gobble something down?
Perfect.
Sounds good.
You don't look happy, Commissioner Camargo. Would you like more time?
No, I think it should be enough. I'm just wondering if Commissioner Concepcion is dealing with her car and then may have to eat lunch as well. So I don't know if you want to add 10 minutes to that.
Okay, why don't we do, let's just do, we'll do 1:30.
Perfect.
I will say that I apologize in advance to my fellow commissioners. My forecast of how long this meeting was going to last completely off base. So I apologize for that. So let's take a recess until 1:30, and hopefully that'll give Commissioner Concepcion enough time to rescue her car and eat.
Yeah.
Okay,
Thank
so
you.
we're in recess till 1:30.
Great.
Thank you.
Thanks.
Thank you, Chairman. Nice job.
Thank you. Welcome back, Commissioner Stebbins.
Mr. Chair, how are you?
I'm okay. Got through the mind-numbing part of the meeting.
We got to the important part. I grabbed a light because you said I was sitting in the dark and I didn't want anybody to.
You definitely were in the shadows. I don't know why.
I got a face for radio though.
Commissioner Concepcion, how's your car? Do you have one still?
I saved it.
Oh, good.
Literally, the tow truck was behind my car. Street cleaning day today, and I forgot about it. So
I'm glad we were able to get you out of here.
me too.
Did you have time to grab lunch as well as saving your car?
No, but I have applesauce, so that's what we'll do. It's fine.
That sounds dismal. I like applesauce though.
It's my son's. So.
I was about to say, you're stealing that, Mom.
Hi, Commissioner Roy.
Hi, Mr. Chairman.
How are you?
I'm good. I had a nice, I don't mean to rub it in, Commissioner Concepcion, but I had a nice salad that I wolfed out. So I was sorry.
It's okay. I will live vicariously through you.
Yes. Commissioner Camargo, are you anywhere to be found?
Hi, Chair.
You back?
I'm back.
Yeah, I don't see you, but I'll take your word for it.
I'm here.
Okay, well, it is 1:31 and the commission is back in session. Hi, there you are. We have reached the agenda item where we have several topics for commission discussion and votes, as you can see on the slide. Let's start off by welcoming Dr. Johnson, our research director, who is going to cover a report that's required by the legislation on potency. I will ask you, Dr. Johnson, if it's okay. First of all, welcome. Thank you for joining us. Second, am I correct, Dr. Johnson, that this is the last of the legislatively mandated topics for reports that we're required to do? I know we're not done in your department. We have a lot more work to do and a lot of other topics to investigate, but we have now fulfilled the mandate in terms of research topics from the legislation. Is that correct?
Yeah, absolutely. So this is the last of the 3 one-time research agenda items outlined in Chapter 55. However, the ongoing research agenda items that were codified into 94G will continue as annually as mandated.
Okay, I didn't want to imply that your work was done. I know it's not, but it's a good milestone that we were finishing the last of the mandated reports, at least the first pass of them. So thank you very much. And without any further ado, why don't you get started? And again, thank you very much for joining us today.
All right, great. Well, thanks for having me. Thank you, Chairman Hoffman, Commissioners Roy, Concepcion, Camargo, Stebbins, and Director Collins for your time and attention this afternoon to discuss the research report entitled High Tetrahydrocannabinol Cannabis and Effects on the Human Body. More research needed, legislative report and considerations for research and policy. Since this is the first research report being presented to all new commissioners together, I wanted to first preface it by saying that these presentations tend to be very high level for public consumption, but I welcome any questions for future discussion afterward, anything that would be helpful for you. So this report has been prepared in response to the enabling legislation, Chapter 55, Section 30F, which reads, the Commission shall investigate, in conjunction with the Department of Public Health, the effects of marijuana and marijuana products with a high potency of tetrahydrocannabinol on the human body and recommend whether there should be restrictions on the potency of THC in marijuana and marijuana products. Sorry, I can't see the slide. So oh.
Okay, yeah, I'll help you out. So Matt, next slide, please. Matt, thank you. Go ahead, Julie.
Sorry about that.
No, I'll help you. I'll get the slides moving in the appropriate sequence and timing. Go ahead.
All right, great. So what do we mean by potency? To first put this whole topic of THC potency into context for the public at large, I thought it would be helpful to first review some of the main building blocks. So cannabinoids refer specifically to a group of varying molecules that bind to cannabinoid receptors in the body. There are more than 100 known cannabinoids that we know of, which are further categorized as endogenous, which are naturally produced in the body, synthetic cannabinoids, which are produced in a laboratory to mimic phytocannabinoids, and phytocannabinoids, which we are concerning ourselves with today, which are produced in the cannabis plant naturally. Specifically, the ratio of two phytocannabinoids, delta-9 tetrahydrocannabinol, THC, and cannabidiol, CBD, are critical for understanding cannabis potency. So THC is the main psychoactive cannabinoid, contributing to its cognitive and therapeutic effects, as well as its substance abuse dependence potential. CBD is the non-psychoactive, but a highly physiologically relevant cannabinoid. And effects of CBD include anti-anxiety, antipsychotic, antioxidant, anti-inflammatory. And important to note here is that CBD moderates some effects of THC. And generally speaking, when we're talking about potency, it refers to amount of substance needed to achieve a particular effect. However, the unique characteristic of cannabis means that there is no specified dose that can reliably achieve a particular effect across all individuals, or what we refer to as reliability in research studies here. So for purposes of this report, we interpret THC potency as THC concentration, or the THC content per volume or weight of cannabis products, usually measured in milligrams or percentages. Matt, next slide, please. Beyond it being outside of our expertise and ability, which it is, the Commission is unable to directly investigate the effects of THC on the human body due to research barriers around using the cannabis plant, the feasibility of isolating one chemical component or cannabinoid in the cannabis plant, and federal restrictions on human testing. To fulfill this legislative requirement, the Commission instead analyzed medical and adult use sales data and conducted a high-level scoping literature review. Next slide, please. This is another slide for context, but one that is essential here for understanding the barriers to conducting research with cannabis in the US, which contribute to the major gaps in the scientific literature surrounding the impacts of high THC concentration cannabis products in the human body, and severely limiting our ability to enact and implement evidence-based policy decisions. In a very, very condensed overview, the Drug Enforcement Administration, or DEA, currently classifies cannabis as a Schedule I drug under the 1970s Controlled Substance Act, meaning there is no federally accepted medicinal use, and it is additionally labeled as having a high potential for abuse. Researchers trying to conduct studies that involve human cannabis consumption, including clinical trials, must obtain FDA and DEA approval. After this lengthy approval process, the researchers can only use cannabis approved by the National Institutes for Drug Abuse, or NIDA, which is grown and managed by the University of Mississippi, the only federally approved cultivator of cannabis for research purposes. This cannabis supply in the NIDA drug supply program does not mirror the array of products sold at cannabis retailers, nor the variety and regional differences in cannabis. Additionally, and importantly, the quality of products out of the University of Mississippi for research purposes may be poor. Given these limitations on federally supplied cannabis, even if a researcher was able to navigate the regulatory and institution-specific barriers, as well as the IRB, or the Institutional Review Board processes to obtain funding to conduct the research, the researcher's studies findings may only have limited utility for understanding cannabis effects on humans, which is obviously needed for this assessment. These processes resulted in both a lack of standardization across studies that we do have published, and studies that are reliant on low THC products, which make cross-study comparisons challenging. Really important here is in May 2021, actually during the writing of this report, a joint notice co-authored by multiple National Institutes of Health, or NIH agencies, directed researchers funded by these institutes to measure and report their findings from clinical research on cannabis using a standard unit of 5 milligrams THC. The purpose of this standardization is to allow for greater comparability between studies and ultimately increasing scientific knowledge and increasing real-world application, such as evidence-based policy decisions. For purposes of literature review, is to identify studies and reports conducted on relatable areas of the topic. For this report, these reviews included the effects of high THC cannabis on the human body in medical and adult use contexts, as well as the illicit market. Since medicinal cannabis is the most well-studied, we focus on that literature base. And given the complexity of studying cannabis scientifically, we focus on published meta-analysis in both the peer-reviewed scientific literature and the gray literature bases, such as government reports. The current state of research on the medical efficacy of cannabis to treat specified disorders and symptoms is actually pretty mixed and varied. There is insufficient evidence on the short and long-term health effects of THC and CBD products, especially under legalization, which expedited the production of novel cannabis products and higher THC concentrated products compared to those products used in clinical trials, which, as we just discussed, are usually lower concentration THC products. And unlike medications approved through the formal data-driven process of the FDA, there is no clear optimal dosing information of cannabis in its approved medical conditions, which again also varies across states. The newly enacted standardized THC dose for research may alleviate this fundamental limitation as it pertains to THC. However, further research will still need to be done to assess interactions with other cannabis chemical components, varying routes of administration, and variation in test subjects themselves. The most comprehensive review of the evidence regarding the health effects of cannabis was actually published in 2017 by the National Academies of Sciences, Engineering, and Medicine. The report, The Health Effects of Cannabis and Cannabinoids, the Current State of Evidence and Recommendations for Research, considered over 10,000 abstracts on the effects of medical cannabis for a variety of diseases, illnesses, and disorders. Important to this legislative report are the recommendations made by the National Academies based on the collection of this evidence. The first recommendation was for public agencies and other stakeholders to first provide funding and support for a national cannabis research agenda to develop comprehensive research evidence. The second recommendation seeks to improve research quality by suggesting that the relevant federal agencies, such as NIH, jointly develop a set of research standards. And lastly, the third recommendation asks for improved surveillance capacity and suggests that federal agencies address the current barriers to conducting research with cannabis, as we just discussed. Next slide, please. So for this report, we extracted Massachusetts medical sales data from May 1st, 2019 to March 31st, 2021, and adult use sales data from December 1st, 2018 to March 31st, 2021. Specifically, we extracted the total sales in dollars for each product category and total units of the products sold for each month within that study timeframe. We calculated market share for each product type as the percent of total expenditures, excluding tax, we don't collect that, and the share of total units as the percent of total units for each product category. We focus the data parts of this report on cannabis product types that are more likely to have high THC concentrations as we attempt to isolate the use of high concentration cannabis products within our markets. As there is not a universal definition of cannabis product types likely to have higher THC concentration, we follow Washington State's 2020 report's approach and consider potentially high THC cannabis products. And under those that umbrella term would be cannabis concentrates, vaping products, and edibles. So this table shows the total sales in millions of dollars on the left, on the y-axis or vertical axis by product type. So you can see the breakdown of product types that contribute to the total monthly expenditures. And what is important to view here are the categories more likely to have high THC products, including the vapes and concentrates products in blue and the infused edibles in yellow. Here we can actually visually see that there is a high market demand for high concentrated THC products in the adult use market. Next slide, please. Another way to visualize this information, this table shows the percent that each product category made up of the total dollars spent this month or that month. We can see that in December 2018, vapes and concentrates made up 35% of total adult use sales and buds made up 45%. In December 2020, vapes and concentrates made up 25% of total sales, and again, buds made up around 45%. It is important to note that the dip here in this graph shows the evaluated public health crisis and commission quarantines on vape products. Next slide, please. Similarly, the following two tables show the same information, but for the medical sales data. This table shows the total sales in millions of dollars by product type. Again, what's important to view here are the vapes and concentrate products and infused edibles in comparison to the buds and pre-rolls. In a very similar trend with the adult use market, we also see a very high market demand for high THC concentrated products in the medicinal market. Next slide, please. In May 2019, vapes and concentrates made up 30% of total medicinal cannabis sales, and buds made up 43%. In May 2020, vapes and concentrates made up 23% of total sales, and buds made up 48%. So again, what we're seeing here is a very large market for high concentrated THC products within both legalized markets, both the adult use and the medical markets. Next slide, please, Matt. So all research needs to be understood in context of its limitations. This study only included legal sales data. In this data, we are limited to using potentially high THC cannabis product categories because in the data's current form, it does not allow us to extract THC concentrations without an exhaustive manual process, something I know Dr. Sarkis is working on right now as we speak, probably. This approach is further limited since some individual products with lower amounts of THC may be grouped together in this higher THC category, and these cannot be differentiated at that level at this time. While sales data is one way to understand consumer behavior, it does not capture home grow or illicit market use. To address this limitation and to better triangulate trends in potentially high THC cannabis consumption, other states' reports leverage an optional cannabis, or what we call the marijuana module, in their state's behavior risk factor surveillance system, or BRFIS data. This module contains cannabis or marijuana behavior questions and is a strong surveillance measure because participants are a generalizable state sample. Unfortunately, the Massachusetts BRFIS does not include this optional cannabis module, which asks about the mode of cannabis use. While Massachusetts does add in multiple option of questions related to cannabis, the mode of use or other measures that could identify potentially high THC products are not currently available for surveillance purposes. Thus, we do not include any of this BRFIS data in this report. Lastly, given the federal scheduling and barriers to using cannabis for research, as previously mentioned, the peer review literature is very sparse concerning the impact of high THC cannabis on the human body. Next slide, please. So regarding the requirement outlined in Chapter 55, Section 30F, to make a recommendation of whether THC concentration should be capped, we additionally reviewed articles for policy options and analysis pertaining to cannabis THC concentration limits, such as tax based on concentration and initial restrictions on edibles and high THC products, etc. However, as you can guess, specific assessment of these policy options and potential unintended consequences have not been extensively studied. Therefore, this report states that we did not find sufficient evidence to recommend a concentration cap at this time. This assessment is due to the current lack of standardized research, but more importantly, in light of potential unintended consequences, such as pushing users to the illicit market, which could have unintended consequences regarding social equity, public health, and public safety. A reassessment in the future may be warranted as the scientific evidence matures, but in the interim, we see it as vital to increase the research that would assist policymakers to make evidence-based policy decisions regarding caps in the future. Thus, this report offers multiple considerations to increase that data capacity. Next slide, please. The first category of considerations are specified for research. So research could assess the newly enacted 5 milligram THC dose with varying concentrations of other cannabinoids in the cannabis plant, specifically CBD, to assess differential effects regarding interactions in cannabinoid ratios or cannabinoid profiles with the other 100 chemical components in a cannabis plant. Research could assess how patients in the current regulated markets use medicinal cannabis for varying illnesses and symptoms, including dosage, modes of administration, THC concentration, and differential effects. This assessment would both permit policymakers to better understand the concentration of products used by medical patients for their conditions and assist researchers in designing better future studies. Next slide, please. Researchers and clinicians could develop guidelines on how to administer medical cannabis for varying concentrations, including indicators of potential side effects and effectiveness for specified conditions. It is also important to consider the labeling and packaging of products to ensure that patients understand the concentration and dosage of their prescription. This would assist medical providers to be able to guide patients in more safe and effective ways to consume cannabis for medicinal treatment. Researchers could study policy mechanisms that could impact THC concentrations in the legal market, including tax based on concentration, concentration-related price floors, THC limits, initial restriction on edibles and high THC products that certain states had implemented, dose or serving size labeling requirements, and data collection requirements to monitor trends and harms. Next slide, please. Research could assess how THC concentration levels in the legalized market affect purchasing and consumption behaviors in both the legal and illicit markets. This assessment would help guide policy decisions and harm reduction ways to prevent adverse clinical and public health effects, such as prevent increased cannabis use disorders, cannabis-induced psychosis, and healthcare utilization, as well as public safety effects, such as eliminating illicit market activity and, importantly, reduce inequalities and inequities in criminal justice incidents by cohorts we know to be disproportionately impacted. Additionally, alternative data sources such as sales data and seed-to-sale tracking could be used for future resources. These metrics would provide a more accurate picture of how patients in the current markets are using their medicinal cannabis. Next slide, please. The second category of considerations regard policy and regulatory considerations. So states enacting and implementing cannabis policies for medicinal and or adult use could implement effective seed-to-sale tracking to monitor legal cannabis throughout the production lifestyle, including testing of each batch's cannabinoid profile, including THC concentration. In regard to concentration, seed-to-sale tracking allows for comprehensive monitoring of product purchase behaviors and sales, which help facilitate research and guide policymakers and regulators on varying issues, including surveilling high concentration cannabis products through the legal supply chain, enforcing concentration-related regulations if applicable, collecting and concentration-based taxes, again, if applicable, preventing high concentration products diversion to youth, and to help inform research to eliminate or at least reduce the illicit market. Next slide, please. Similar to Massachusetts, other states with comprehensive seed-to-sale tracking systems could consider building databases to allow for public health and safety purposes, in addition to using it as just a compliance platform, similar to us that we do the Commission's Open Data Platform. So similar to New York, other states' medicinal cannabis regulations could consider that patients' conditions and symptoms also be included in the seed-to-sale tracking system, which allow linkages of that information to medical cannabis purchasing behaviors. This may help facilitate research, including assessment of effective THC concentration of cannabis products and modes of administration for treating specified illnesses and symptoms. Additionally, platforms should track all concentration levels and pricing in order for research to better evaluate patient utilization. Next slide, please. Recently published research at Boston Children's Hospital found increased access and use of diverted medical market cannabis from the regulated market to youth in a sample of youth in outpatient treatment for cannabis use in Massachusetts. To prevent youth diversion, specifically for high THC cannabis, which is more harmful to some youth, specifically youth without medical need, states could limit high THC concentrated products in the medicinal market to specify efficacious medical conditions such as cancer pain, or dispense high THC cannabis to those within a specified age bracket such as 18 to 21. To enact this, however, it would require better research on what types of cannabis and cannabis products and specified cannabinoid profiles are advised for specified conditions. Next slide, please. States could license and regulate research facilities conducting research using the cannabis plant. The Commission licensed marijuana research facilities as well as issues or will be issuing research permits or research projects to be conducted within those licensed facilities. This process, or these processes, would expedite research hindered by barriers to conducting research with the cannabis from the only federally approved cultivator out of the University of Mississippi, as we had previously discussed. States could develop evidence-based cannabis prescribing guidelines for cannabis products based on the currently available scientific evidence in collaboration with both clinicians and cannabis researchers. This would allow more effective prescribing of products, including THC concentrations, to medical patients with specified diagnosis, illness, and symptoms for which scientific studies have shown efficacy for. Next slide, please. States could implement additional taxes on non-medical high THC cannabis. This public health-based approach would theoretically disincentivize buyers from purchasing higher THC cannabis, potentially averting adverse effects of non-medical high THC cannabis use. However, there are implementation challenges to this approach, as we found when conducting an assessment of different tax schemes here in Massachusetts in the tax study, which was published back in July 2020. States could implement regulations to only allow high THC cannabis products for medical patients, and more specifically for medical patients with specified diagnoses, illnesses, and symptoms for which scientific studies have shown efficacy. However, assessments of unintended consequences are really critical here to prevent illicit market activity for public health and social equity purposes. Again, additionally, assessments for medical efficacy specifically for youth are really warranted here. Next slide, please. So considerations specific to Massachusetts include the following. The Commission could change its data collection processes to link cannabinoid concentrates to product sales, as the current mechanism requires hand coding. Better linkage could enable precise research regarding the specified levels of THC, CBD, and other cannabinoids that potentially interact in these products to accurately classify high THC concentration products. The Commission could work with its seed-to-sale tracking vendor to provide definitions for each of the cannabis product types classification categories, which would increase our data quality and reliability across studies. This would increase the utility of tracking data for research purposes. And we have some good news because both of these considerations here at the Commission, the internal data governance group led by Dr. Sarkis is working steadily on both of these issues. So I have full confidence that we're in good hands. Next slide, please. The Commission could continue its work to increase research capacity within the state, such as the implementation and regulation of research facility licensing and research permits, and advocate for decreasing federal barriers in cannabis research. And importantly, for future surveillance system purposes, is adding metrics to the pre-existing surveillance systems that we have in place, including the Behavior Risk Factor Surveillance System, or BRFIS, the Youth Risk Behavioral Surveillance System, and youth health surveys, as well as the Pregnancy Risk Assessment Monitoring System, or PRAMS. Next slide, please. The Commonwealth could use industry seed-to-sale tracking data and combine with the Regional Center for Poison Control and Prevention to monitor both high THC concentration cannabis among youth and potential diversion from legal markets. Massachusetts could develop and add a section on high THC cannabis products for inclusion in the Responsible Vendor Training, or RVT curriculum, notably the Advanced Core Curriculum, to be implemented in July 2022. Next slide, please. Lastly, our considerations relevant to education. Research suggests that some cannabis consumers do not fully understand labeling and what constitutes high THC concentration products. To increase this understanding, the Commission could create additional public awareness materials or build upon its campaign More About Marijuana to educate consumers on what constitutes high THC concentration cannabis. States' medical societies, such as the Mass Medical Society, and educational programs could add cannabis as medicine to clinical and training curriculums, ensuring providers are educated in the current state of research and any guidelines regarding cannabis efficacy and concentration. Next and last slide, please, Matt. So that's it. Thank you again for your time and patience today, and I am happy to answer any questions that you may have.
Thank you, Dr. Johnson. That was great. I do have a question and a comment, but let me turn the floor to my fellow commissioners. Commissioner Stebbins.
Sure. Thank you, Mr. Chair, and thank you, Dr. Johnson. I appreciate your patience, both your and Olivia's patience a few weeks back when I unloaded a slew of questions on you. I have one question, which is, obviously this is a required report that the legislature mandated, and we're fulfilling that obligation. But I found some of your points of, and you and I had this conversation, of where the medical side of the house might be able to better offer us some data to track and follow, and you pointed out what some of those are. Do you expect there's, from looking at other jurisdictions, that this issue is going to come back, like impact of THC is still bubbling out there, and it's, you know, a policy question that other jurisdictions are looking at as well?
Yeah, I think it's definitely a conundrum that all states are trying to figure out without research to adequately address the question at hand. And so it really is a tough question. And there's so many different moving pieces. And so you want to think about it in concert of every piece of it, like the public health, public safety, social equity. It really is a fine line between all of these different things, and making sure that we are allowing, people to legally consume products that are helpful medicinally or for adult use recreationally, without putting more stress on our public health, public safety, and enforcement pieces of society. So it is a question that we're all grappling with, and a few different states have published reports, which we heavily relied on, both Washington and Colorado, and we all kind of come to the same consensus that the research really isn't there yet, and it is something that we are grappling with. And something that I think we do have right now is data, and we could utilize the data, kind of conduct research in a backwards way, which is to look at what patients are using for their medical diagnosis, or what concentrated products are being utilized in our market, and basing potentially future studies and future guidelines on these products.
Thank you.
I don't know if that answers your question.
Commissioner Roy, please go ahead.
Thank you, Mr. Chairman. Thank you, Dr. Johnson. That was a great overview, and I just want to thank you and your team for this comprehensive report. Is highly informative. Speaking of the word highly, I just have a question on the definition of that, Dr. Johnson. So would anything over 5 milligrams of THC be classified as high?
Yes.
Okay, and the second part, I have another follow-up question to that, is there room to parse that out further? So high, very high, exceedingly high. I think that's a broad brush, just using high. There's a big scale there.
There absolutely is. And so right now, when we say high in regards to the THC concentration, we're not able to look at those differences in order to break that down further. In the future, potentially we could, once the data warehouse is kind of up and running, and we have that ability to kind of triangulate out or differentiate out these different products that have these a spectrum of THC concentrations. But I think it's really important to know that right now that research really isn't able to do that. And the quality of research that is conducted, I mean, the quality of cannabis that is used for research tends to be lower THC coming out of the University of Mississippi. And so the products that we have in our legalized markets are very different than the products being researched. And that's a big limitation from where we're coming from. But I hope in the future that we're able to conduct more comprehensive research to tackle some of these questions. Right now, unfortunately, we're not really able to.
Based on our current product catalog, what is the highest level that you're seeing of THC in products available today?
I actually don't know that question.
I'm sorry.
I know we can get to that question. I just don't have it offhand.
Okay.
But a great question.
Commissioner Concepcion.
Thank you. Thank you, Dr. Johnson. Thanks for the report and this presentation. And also, I wanted to say thank you. I did not mention in my opening comments when I participated in Sergeant Decker's cannabis DRE training. Dr. Johnson, thank you so much for coordinating that. And I'm happy we were able to attend together. I had a question, and you've answered it a bit. I had a question about what was grown and managed by the University of Mississippi. And you referenced that it doesn't mirror the cannabis that is sold by retailers. And I understand that there is a lower THC level, but can you expand a bit more on some of the other differences?
Yeah, so the University of Mississippi is the only legalized cultivator and federally to provide research out of the National Institute of Drug Abuse Drug Supply Program for researchers doing this kind of research. So it mainly has, they do have the products that would be under the category of products, like they'll have bud, they'll have edibles to a certain degree, but the variation in the plant varietals, indica and sativa, are very different across the United States. And then these markets, by legalizing, we're giving markets ability to be innovative, and so coming up with different modes of administration, different different kind of products, from dabbing to edibles with higher THC. All of these different products that are in our legalized market are not necessarily being produced or developed by the University of Mississippi for research purposes. Okay. And so products that you're going into the store and getting are very different than the products being studied by researchers getting funding through National Institutes of Health.
Okay, that's helpful. That does answer it. I just want to expand a little bit so I'm making sure that I'm understanding this correctly. So it's the variations in strain, we're talking about indica and sativa, that's where the differences really are, because they have less variations there.
No, so it wouldn't be different. So that's part of it. But I think the biggest part is that the quality is not as good as we have in our legalized markets. And so we have a different quality in the caliber of what people are able to buy legally versus what is being researched under federal jurisdictions.
Thank you.
The varietals are different with that, but yeah.
Sorry about that. Commissioner Roy, go ahead.
Dr. Johnson, what are our friends to the north in Canada doing in regards to research with high THC and caps, if any?
So I probably have said this a lot of times, but Dr. Hammond, Dr. David Hammond at a University of Waterloo is, because I talk a lot about surveillance systems and why they're so important and why they need to be, on ground with what is actually happening at the state levels. So his research is the International Cannabis Policy Study, International ICPS. That work has surveillance metrics that are directly asking questions about mode of administration, what kind of products, what do they think the THC level is in those products. So those are better capturing what's actually happening than a lot of our surveillance systems that we have here in the United States, such as the BRFIS, that is very widely used at the federal, state, and local level. So we have actually contracted out with Dr. Hammond's group, and they have been absolutely wonderful. So we have data back from 2019, and then we're getting 2021. So yeah, they are doing similar research, but yeah.
Good. So if I could, Commissioner Camargo, if you have some questions, I'd like to ask one question and make a comment afterwards. And then I think if it's possible, we need to wind this down. Obviously, there's lots of opportunity to follow up individually with Dr. Johnson afterwards. But if we could, Commissioner Camargo, could you go ahead?
Sure. I'll be quick. Dr. Johnson, thank you so much. I mean, you and I spoke beforehand last week, and we went through some questions, so thank you. And I also thank you for making these report easy for us to understand, right? This is very heavy, and I really appreciate you doing a very thorough report. This question may be for Mr. Executive Director. How do you see this report being used in the future? I know that this is a report, it's a mandate, we're going to turn it in. But how do we use this in the future, Sean? And then also, how does this work in terms of communications or outreach back to our legislators? And just to add to my question, I guess, how do you see this report, informing us, down the line in the industry?
So I think it's required to be submitted to the legislature, so we'll certainly do that and share it directly with stakeholder legislators, especially the Cannabis Policy Committee chairs and the like. As far as how it helps us, I think Dr. Johnson's laid out some considerations. As she noted, some of these things are already on our radar, and I think this research supports those efforts. So I think we should, those things that we can control, we ought to, especially around things like data collection and even trying to build out further. I think Commissioner Roy, your point as far as high THC, higher, and as we get progressively more potent based on product types. Also, I think folding some of that into the product catalog is a good opportunity as well. And then next, I would say sharing this with a group of regulators. So we have the CANRA National Regulators Association. Sharing our research with them is really important, but it may also be considerations that they can take, which would then give us a better data set across the country. If we start to speak the same language, I think we can start to compare apples to apples and just help folks and also help ourselves in the process. To Dr. Johnson's point, the research that the University of Waterloo has been doing historically allows us to have that historical data set that for a lot of new jurisdictions, the best advice I can offer them is begin with baseline research and then track your progress year over year. This is, I think, a perfect example of how that can be used in the future. So not just by us selfishly, but sharing it with other jurisdictions as well.
Thank you. That's helpful. Thank you.
So, Dr. Johnson, a question and a comment. Question on your policy and regulatory considerations, number 3. You mentioned what New York was doing with respect to matching consumption and potency with medical conditions. I don't know if it includes outcomes, but certainly matching consumption with medical conditions. Can you address how New York has dealt with the patient privacy issues to do that? Because it seems like an incredibly valuable piece of analysis to do and tracking to have. But I was just wondering how New York got around patient privacy concerns. And if you don't know, that's fine, but I'm curious.
That is a very good question. I actually don't know. I think it is synced with their, I believe it is synced with their electronic health records, but I am not sure. That is something I can find out and get back to you, but I'm not sure.
Okay. Yeah, thank you. I just think that would that'd be really insightful because we can track the overall consumption of high concentrate or high potency products, but until you can link them with specific patients, specific conditions, and most importantly, specific outcomes. It's not clear what conclusions you could draw. So thank you for that. I would appreciate your follow-up. Yeah. And then the second comment to close this off. First of all, thank you for your presentation. I thought it was great. I thought it was insightful. I learned a lot. As Commissioner Camargo pointed out, I actually understood it, which I appreciate. I will just say, and this is a little bit of a rant, I find this topic so incredibly frustrating that there is no research, that we have this incredibly controversial industry, both on the adult use as well as the medical side, where there are incredibly strong opinions and no facts. And it's because there's no research, it's because of the federal ban, it's because the medical community has really not engaged in this topic. I just find it extraordinarily frustrating, and I hope that collectively in this state, and Sean, through the other states that that are working with you in the regulatory association, we can actually get research started and get the medical community engaged. Because aside from the fact that we can't answer questions like you raised about what potency is okay and what the impacts are of high potency, we can't answer those questions. But my bigger concern and frustration is I think that there's just enormous untapped potential for medical marijuana to help in quality of lives across all age groups. And we're not realizing that potential because of the lack of research. And it's just extraordinarily frustrating. So thank you for listening to my rant, but also thank you for doing your part in advancing that knowledge. Really appreciate it. And this is something I think that as Commissioner spend a lot of time on going forward to answer Commissioner Camargo's question in terms of how do we use this to have an impact. I think there are lots of ways we can and should do that. So again, Dr. Johnson, thank you so much, and to your associates, really appreciate it. And again, I don't mean to cut the conversation too short. We'll all have the opportunity to follow up with you individually, and I suspect that you're going to hear from each of us relatively shortly with follow-up questions and comments. So thank you.
Thank you, Mr. Chairman and Commissioners. Thank you.
Let us move on, if we could, then to the next topic. And the next topic is the annual activities report. Mr. Executive Director, you want to set this up for us, please?
Sure. Thank you, Mr. Chairman. So this now would be our 4th annual activities report, which does reflect the fact that we have been in existence for now 4 years. So by its very title, I think it does reflect the annual activities of the agency. This is something that is statutorily required. State law requires that we annually submit a complete and detailed report of our activities, including a review of the implementation and enforcement of this chapter, that being Chapter 94G, and the governance structure established by the same. And so what you have before you is essentially an updated version of last year's annual activities report. The updates are really department by department notes that I think reflect the activities of our licensing, communications, research, HR, IT, etc. And so it certainly reads as a relatively comprehensive but somewhat data dense information summary. And just to be very brief, I'll go through some of the highlights for you. Again, I think it speaks to how we've implemented the law, developed regulations, and managed a lot of our activities. I note in the report that as of September 1st, we've received 1,263 license applications. We've also received 31,155 applications for establishment agent registrations, and we're in the process of reviewing 236 license applications, as well as inspecting or somehow reviewing 472 provisional licenses. Those numbers, of course, changed as of today with your consideration of the volume of licenses that were before you. We also note in our communications update that we did launch a brand new website this year. I think a data point that's really informational and insightful is that since we've launched it in April, our website has received more than 790,000 page views, as well as 618,000 unique visits, and that data is as of September 14th. Other notes that, again, I just wanted to call your attention to is that in the constituent services and government affairs side of the house, we note that I have a maintained goal of responding to folks within 24 hours time of any inquiry, be it a phone call, an email, or anything of that nature. And I think we certainly strive to meet that time frame, and I think we often do. Also noting that during FY21, so the last fiscal year, we received and responded to approximately 150 requests for public records, which I think also demonstrates the public interest in our work and what we're doing, as well as the materials that we may be producing. And then 2 final notes here. Certainly on the revenue side, you heard from Adriana today. This indicates that we've generated $25.1 million in non-tax revenue. And through May of 2021, the Department of Revenue reported a total of $59 million in marijuana sales tax revenue, as well as $95.7 million in marijuana excise tax revenue for fiscal year 21. Lastly, and my final point is that the agency itself employs 84 staff, of which 62% of them are female and 39% are persons of color. And then our agency's management team is 53% female and 47% people of color. So as I noted, the updates and the activities are really reflective of the agency itself, some of the inner workings of our departments, and hopefully reflects that we continue to make great progress in certainly meeting the will of the voters, but also living up to our statutory and mission-based obligations.
Thanks, Sean. Any questions? Sean, I have one question before we get started. Remind me of what we've done in previous years. Has the commission voted on this prior to its submission to the legislature?
You have. So what I would seek is I guess a motion to approve the report as is. Of course, if there's any edits, you're certainly welcome to offer them, and that you authorize the submission to the legislature.
Okay, thank you. Before I ask for such a motion, turn it over to my fellow commissioners. Do you have any questions for the executive director on this?
I have a quick question. It's the same question I asked earlier. What's the process when we turn these things into we say our legislators? What does that process look like? How are they really aware of these reports?
Sure. So this one we certainly submit formally to the Senate and House clerks, which therefore makes it a formal legislative file. We also submit it, I'm not sure, I think it is explicitly required to the respective House and Senate chairs of the cannabis policy committees. We also publish it on our website. I've seen it on the House and Senate clerk's website. We also share it where appropriate with legislators as we meet with them, because I do think it's reflective of here is the Cannabis Control Commission in a nutshell. And I know we also include it as internally as a material as part of our onboarding process, because I do think it provides that really good, now granted it's not brief, it's probably 15 or 17 pages or so, but it is a good snapshot at the variety of departments here at the agency, as well as the previous year's activities. So I think it's a good place to, if you had to read up on it very quickly, it's a good resource.
Yeah, I mean, it's really well written, and there's a lot of simple information to just understand where we're at and what we've done at the commission. May I ask, or am I out of line by asking to send to the two chairs of the committee?
That is something we do already.
Okay, perfect. Okay, perfect. Okay, thank you.
Thanks. Any other questions before Commissioner Stebbins?
Sure. Just real quick, picking up on the distribution. Do we make this report or share this report with our friends in the Cannabis Advisory Board?
We do, yes.
Under the revenue section, I'm not sure if I'm reading it correctly, but was there a number that we should pull out that covers the amount of fines we might have collected in the previous year?
That would be covered within the 25.1 million of non-tax revenue. We could certainly pull that out as a specific clause within that of which X volume of dollars is subject to, I guess it would be direct fines. So the 25.1 figure comprises fees, so agent fees, license fees, as well as fines that may be levied by the commission.
I think it might be helpful just to kind of really, one is a testament to the vibrancy of the industry. The other one is, representative of the commission's regulatory authority. But I think the legislators or people reading the report would see that most of the revenue is coming right from license fees and agent fees.
Other questions or comments? Commissioner Roy?
Yeah, I just want to thank Executive Director Collins and the staff. This is very well written. It's very comprehensive overview for anyone that wants to learn about the state of the cannabis industry and what the commission has been doing. So I just want to thank you very much for all your work on this.
Thanks. Okay, I don't see any other hands raised. So, Mr. Executive Director, would you mind repeating the motion that you'd like us to consider?
So I think based on the feedback from Commissioner Stebbins, it would be to approve the fourth annual activities report with the adjustment discussed by Commissioner Stebbins relative to further describing non-tax revenue. And then once the change is made, to authorize the submission to the legislature, and to Commissioner Camargo's point, to explicitly submit to the chairs of the Cannabis Policy Committee.
Great, thank you. Can I have somebody to make that motion, please?
So moved.
Thank you, Commissioner Stebbins. Could I have a second, please?
Second.
Okay, let the record show. Thank you. Let the record show that Commissioner Stebbins made the motion to approve, seconded by Commissioner Roy. Commissioner Camargo, your vote?
Aye.
Thank you. Commissioner Concepcion? You're on mute.
Aye.
Thank you. Commissioner Roy?
Aye.
Thank you. Commissioner Stebbins?
Aye.
Thank you. Commissioner Hoffman, aye. Let the record show the commission approves the motion by a vote of 5 in favor. Commissioners Camargo, Concepcion, Roy, Stebbins, and Hoffman with none opposed. Thank you, commissioners, and thank you, Mr. Executive Director, for your leadership, and thank you for following through on delivering, finishing the report with the input from Commissioner Stebbins, and for filing it as appropriate. Thank you. Lest you think you're off the hook, I think you're still up, Mr. Executive Director. Next topic is job description for a new position, Constituent Services Manager. Are you going to talk us through that, or somebody else?
I'm happy to talk you through it.
And please go ahead.
So I bring before you today, much like our discussion last month, as a reminder, any new position at the agency, based on the delegated authority, I will and am obligated to seek the approval of the commission. So what I'd like to do is, I think, lay out before you a vision for our constituent service office. Right now, we enjoy the benefit of Kathy Oliver Jones serving as our Director of Constituent Services. She's exceptional at her job, and one of the things that she does on a daily basis is certainly interact with constituents, be they patients or any other folks that may interact with our agency, as well as oversee and manage the day-to-day work of, I believe it's now 3 constituent service associates. So much like our licensing department, what we're proposing is that in addition to Kathy and the constituent services associates, we install the role of a constituent services manager to really be a manager of those associates, thereby allowing Kathy Oliver Jones to become, I think, the visionary leader that she can be in our constituent services operation, and also continue to support ongoing agency-wide activities and plug into those matters such that she can relay that information back to the staff that are working really on the front lines of our interactions with the public. So that model works very well on our licensing side. So we have Kyle as a director of licensing. He has the licensing managers and then our licensing specialists. And so this role would serve as a licensing manager peer, ultimately. What we are doing across the entire agency as well is beginning a process of looking at job classifications across the board and evaluating, as we've built our agency, what are like positions. And so this really continues that work, and I think serves as a really good model. And I've already been corrected, which I'm not surprised. We have 5 constituent service associates here at the agency, and so this role would serve as their manager. Again, I think it fits really well with the model that has proven successful here at the agency, and I would certainly seek your support for the additional role, which I think frees up Kathy, again, to continue leading here in the agency, and also allows for her to have additional support on the management side, which I think would just overall make the functions more efficient and make the parallels even closer between different departments. So again, I'm happy to entertain any questions you may have, and certainly excited to bring this role into the agency.
Thank you, Sean. Are there questions for the executive director before I ask for a motion? I'm seeing none. Then could I ask, please, for a motion to approve the executive director's request to create this job description and to seek its fulfillment?
So moved.
Thank you, Commissioner Camargo. Could I have a second, please?
Second.
That was Commissioner Roy.
Yes.
Thank you. So let the record show the. Sorry.
I think Concepcion said it first. I'm just clarifying.
Okay.
Okay.
Thank
you. I'm
no
off
problem.
mute.
No problem. So let me let the record show that Commissioner Camargo made the motion, seconded by Commissioner Concepcion. Commissioner Camargo, your vote, please.
Aye.
Thank you, Commissioner Concepcion.
Okay.
Was that? I'm sorry, Commissioner Concepcion.
Aye.
Thank you, Commissioner Roy.
Aye.
Thank you, Commissioner Stebbins.
Aye.
Thank you, Commissioner Hoffman. I let the record show that the motion was approved by a vote of 5 in favor. Commissioners Camargo, Concepcion, Roy, Stebbins, and Hoffman was not opposed. Thank you, Mr. Executive Director. Next topic is renewals for, I think, 5 RBT training companies. Olivia, you're going to walk us through this?
Yes, I am.
Great. What I appreciate, I'd like to do this as a roster. So if you could go through all 5 of your recommendations, and then we'll vote as a roster on them. I'd appreciate that.
Okay, yeah, not a problem.
Thank you. Please go ahead.
Thank you, Chairman Hoffman. Today, there are 5 responsible vendor training renewal applicants presented before you for your consideration. The following applicants for your consideration are seeking a renewal of their 2-year certification for responsible vendor training. They have been certified with the Commission since October 2019. The entities are titled Bartuca Consulting, Cannabis Trainers, Medical Marijuana 411, Stoker Consulting, and Quality Control Analytics. The first entity, Bartuca Consulting, operates out of Wrentham, Massachusetts. They have trained approximately 1,400 agents since their certification in 2019. There have been no updates to their contact or ownership information, and they have remained current with all regulatory changes and curriculum updates. Next, we have Cannabis Trainers, who operates out of Denver, Colorado. They have trained approximately 3,700 agents since their certification in 2019. There have been no updates to their contact or ownership information, and they have also remained current with all regulatory changes. Next, Medical Marijuana 411, which operates out of Redmond, Washington. They have trained approximately 100 agents since their certification in 2019. There have been no updates to their contact or ownership information, and they have remained current with all regulatory changes. Fourth, we have Stoker Consulting, which operates out of Lexington, Massachusetts. They have trained approximately 2,000 agents since their certification in 2019. There have been no updates to their contact or ownership information, and they have remained current with all regulatory changes. And finally, we have Quality Control Analytics, which operates out of Assinet, Mass. I apologize if I pronounced that incorrectly. They have trained approximately 2,100 agents since their certification in 2019. There have been no updates to their contact or ownership information, and they have also remained current with all regulatory changes. So my motion would be that the staff recommends your approval of all 5 of these renewal applications, if there are no questions.
Thank you, Olivia. Before I ask somebody to make that motion, are there questions for Olivia, excuse me? Go ahead, Commissioner Roy.
I just need a point of clarification, Olivia.
Yeah,
The curriculum, it lists on each one, the bullets say change of ownership. What is the curriculum? Are they the same on each one? Like, I would like moving forward, more information on the curriculum that they're providing.
Yeah, so are you looking for an, if there are updates to the RVT curriculum since they were certified 2 years ago?
Yeah, or yeah, I mean, is there a different curriculum, or am I missing something on these reports about their curriculum?
No, so these are RVT providers who we certified 2 years ago, and their license expires every 2 years. So
right.
They're just looking for a renewal of their application.
Are they, I guess, I'm sorry, are they teaching different things, different courses? Or are they all teaching? So we have 4 vendors teaching the same thing, or 4 vendors teaching different things is what I'm asking.
They are all teaching the same exact RVT curriculum.
And okay, that's what I thought. So the reason for 4 is what?
5.
5.
Yes, there's 5. So we have 20 currently certified RVT trainers. These are 5 whose licenses were expiring, so they're up for renewal and submitted renewal applications.
Yep.
Does that answer your question?
Okay. That's Commissioner. Go ahead, Commissioner Roy.
No, I guess there must be, it fills demand. I am assuming to have 5 teaching the same thing. That's okay.
Yes, yeah, so, of course. That's more of a market consideration. They're just businesses that we're certifying, and it's up to them to advertise for themselves.
Okay, thank you.
Commissioner Camargo?
Yeah, no, I'm sorry. I was just gonna interject a little bit. I think I understood what Commissioner Roy was trying to ask. So Commissioner Roy, I was going to try to help you out there a little bit. I think, yeah, I think you started saying it, Commissioner Roy. You know, there's a lot of stuff on the agenda, right? And we're looking at a lot of stuff. And I think that the RVT training is definitely something that we probably want to know more about. And I think Olivia had done a presentation a few months ago. I know Commissioner Stebbins has been working on RVT training, so maybe it's something he could talk a little bit, you know, more about. My question, Olivia, and I'm sorry I didn't get to you before the meeting, because I usually, you know, kind of like to ask you some meetings before public meetings, right? So we can save time. But besides the regulatory compliance that you described, how are we measuring these businesses? We certify them, and they're training tons of frontline workers and agents from a curriculum. How are we making sure that they're doing the right thing in terms of trainers, in terms of training frontline workers? What are the measures that we put in place?
That's a great question, and something that I've been working with our enforcement team on as of late. One item which changed a bit because of the COVID-19 pandemic was there was something in place where we would be going into classrooms and making sure that the training was accurate. Of course, with online training, this became difficult. But I personally, when I review applications, do also go on to their online courses, get my own login information and review the courses. And then our enforcement team is going into marijuana establishments and medical treatment centers and getting the certifications that way.
Okay, that's helpful to hear. Thank you. I'll follow up with you offline because I have a few questions just from, I think, stories that I've heard in terms of frontline workers. So it would be interesting to just kind of make the connection. So thank you.
Yeah, absolutely. And I will add too that I'm planning on sending out a meeting invite to all of the commissioners to have a follow-up on RVT and just give you all a bit of a refresher on it.
Thank you.
Thank you for that. Other questions? So it is, Olivia, it is the recommendation of staff that we approve the renewal for all 5 of these vendors. Is that correct?
Yes, that's correct.
Thank you very much. Could I ask one of my fellow commissioners to make a motion to do so, to approve the renewal for these 5 RBT vendors?
So moved.
Thank you, Commissioner Stebbins. Could I have a second, please?
Second.
Thank you. Let's record show that Commissioner Stebbins made the motion to approve, seconded by Commissioner Camargo. Commissioner Camargo, your vote, please.
Aye.
Thank you, Commissioner Concepcion.
Aye.
Thank you, Commissioner Roy.
Aye.
Thank you, Commissioner Stebbins.
Aye.
Thank you, Commissioner Hoffman. Let the record show that the commission approved staff recommendation to issue renewals to these 5 RBT vendors by a vote of 5 in favor. Commissioners Camargo, Concepcion, Roy, and Stebbins and Hoffman, with none opposed. Thank you very much. Olivia, thank you very much, not just for your time today, but for your leadership of this important program. And thank you for offering the follow-up. I'm very much looking forward to getting that invitation, as I'm sure my fellow commissioners are as well.
Of course. Thank you, Chairman Hoffman, and thank you, commissioners.
Thank you, Olivia. Nice job.
Thank you.
Olivia.
I would like the forbearance of my fellow commissioners to take a 5-minute break. Can we actually do a 5-minute break? So it's 2:35. Can we get back in session at 2:40? Does that work for everybody?
Yep.
Thanks. So we're in recess until 2:40. Thank you.
Chairman, I know we're live, but I'm glad we didn't take no bets on your prediction of today's meeting.
Yeah, I said I totally screwed this one up. I'm usually better than this, but you know, it was worth it. I mean, I think, you know, everything that we went through is important, obviously, and we had some good substantive conversations. So I apologize again for my lack of prognostication abilities.
You're like the weatherman. We always ask you before every meeting.
I'm usually better than I usually do better than I did today, but so be it.
It's
Okay,
awesome.
it's 2:40. Commissioner Concepcion, Commissioner Roy, are you back?
I am back.
I see you. Okay, everybody back?
Can you hear me okay? Is my
No,
speak?
you're cutting in and out, which is why I didn't hear, you know, the motion you seconded. The reason I call on you because I didn't hear you make that second. So I don't know.
Yeah, and I apologize because I didn't hear you either. I wouldn't have made the second.
No, I'm figuring out that there's something wrong with my audio. Maybe if I'm closer, is this better?
Yeah, you're fine right now. So you know, if we can't hear you, I'll let you know, and we'll give you a second chance. Okay, it's 2:40. We're back in session. There's one remaining topic for commission discussion and votes, which is the topic of disproportionately impacted areas, specifically Lawrence. Again, as everybody will recall, we started a conversation on this at our last meeting in September. We took a vote and agreed to table it for a month. It is now a month later, and so it is back on the agenda for discussion. I would like to turn the floor over, if it's okay, to Commissioner Camargo to lead us off in this discussion. Please go ahead, Commissioner.
Yeah, no, thank you, Chairman. Can't believe it's been a month. I think time is flying.
Well, welcome to commission time.
I know. But thank you, Chairman. Thank you, Executive Director. And most importantly, to our legal team and our communications team, including our Director of Government Affairs, Matt Jancola and Kevin Sibley, who put in overtime the past 3 weeks to prepare us for today's meeting, particularly when it comes to the city of Lawrence. So just want to give a real shout out to our legal team who's done a lot of work behind the scenes to get us here. Before I move on to my remaining comments, I wanted to call our Director of Government Affairs, Matt Jancola, the stage, and wanted Matt to give us a quick update on from the CCC side.
Matt, this is an opportunity. You're always behind the scenes running these meetings. This is, I think, your first on-camera appearance, so welcome.
It's good to be here. Thank you, Chairman. Thank you, Commissioner Camargo, and thank you to the other commissioners. I appreciate the opportunity to give you this update. This Tuesday, Government Affairs staff, joined by Commissioner Camargo, held a call with Mayor Kendris Vasquez of the City of Lawrence in response to the Commission's September public meeting motion to reach out to the city regarding our ongoing work to review and potentially update areas of disproportionate impact. After briefing the city on the Commission's previous 2 reports and the Commission's follow-up work begun in April 2021, the city indicated that they are supportive of being included in the list of disproportionately impacted areas. The mayor further indicated that he would draft a letter of support to the Commission on that fact. That letter, excuse me, was shared with the Commission this morning. So the city is now reviewing the data the Commission needs in order to incorporate their data set to the NIBRS data format used by other municipalities in our study. In the weeks ahead, Commission staff will sit down with the city staff that are identified as in charge of collecting that data, as there might be outstanding questions and perspectives regarding the quality of the data and timeline for distribution to the Commission. I'd just like to extend my thanks to Mayor Vasquez. We are grateful to the city for sitting down with us, offering their perspective, and we look forward to our ongoing collaboration. Thank you.
Thank you, Matt. Any questions for Matt before we turn it back over to Commissioner Camargo? Thank you again, Matt. Please go ahead, Commissioner Camargo.
Yeah, thank you, Matt. Thank you so much for your leadership in this work. So thank you. I know you have a lot on your plate. I also wanted to let folks know, and I think we had mentioned it last month, but State Representative Frank Morand and State Representative Marcos Devers also sent letters of support around this matter. So as you heard earlier, we met with the mayor on Tuesday from the city of Lawrence, and he is willing and eager to work with the CCC on collecting enforcement data. As of right now, we do not have the sufficient data, and it will take a few months. We all know that this is a process to collect and analyze that data. As the sponsor of this proposal, I would like to make a recommendation followed by a motion to table until the commission has collected sufficient data on Lawrence and public feedback on disproportionately impacted areas designated. In the meantime, I think we continue to not think, but we do continue to do our outreach efforts and educational awareness to the city of Lawrence and other identified areas. Our executive director, Sean Collins, spoke today about Elevate New England's upcoming Zooms that we're having. And I think that's going to be very helpful, not only to Lawrence, but to the other identified areas.
Thank you very much, Commissioner Camargo. So we will certainly entertain your motion, but before we do, can I ask my fellow commissioners, are there questions or comments they have before I ask Commissioner Camargo to make that motion? Commissioner Roy?
I just want to thank Commissioner Camargo and Matt for all their work and outreach on behalf of the commission in this very important subject. And I was curious, do you have any idea of their timeline? How long it will take the city of Lawrence to be able to ascertain and collect all that data to provide to us?
Yeah, so I think we're going to have to now work with our research team, with Dr. Johnson. And I know Matt has already started doing that in terms of formulating what that is, right? What is the data that we're looking for? The mayor has to assign someone on his team in the city to start collecting that data. So I think that, now it's up to us behind the scenes to start doing it and collecting it. But it will take some time.
Commissioner, may I ask you, is there a way to reach out to this? Because the city of Boston had to execute the same exercise, right? Is there a way to reach out to them to see how they were able to do it and to provide it to us?
I think the best way, and Matt and Cole, I think you're still on the call here, but I think the best way is to go through our Dr. Johnson, and Matt has already started those conversations with her. And if she thinks it's a good idea, then I think we go from there. But I think we take on her recommendation in terms of what this looks like, so it's collected correctly, and we're not recreating the wrong wheel here.
Yeah, I think with respect to Commissioner Roy's point, let's just keep that in reserve. It did work with Boston, and we had a couple, just for historical context, we had a couple of fits and starts with Boston in terms of getting to the right people and getting the right data. So there's maybe a lesson learned. I'll leave it in Dr. Johnson's hands as to whether it makes sense to reach out to Boston, but I think there's some analogies that might be useful. Mm-hmm. Other questions or comments? Commissioner Stebbins.
Sure. Thank you, Mr. Chair. I appreciate Commissioner Camargo's work and incredible Matt Giancola, who obviously is a handyman at so many different responsibilities of his job. I do want to kind of offer an apology, because I think I put my proverbial foot in my mouth last time we had this conversation, and it really was around, with this 2-month extension of the SEP application program, that we could really push hard into communities like Lawrence and some of the others that we know might find themselves as a disproportionately impacted area after review of this second study is completed. At the time, what I was trying to suggest is that we had a window where we could really go back into those communities and push. And as we've heard today, Elevate is doing a lot of that work. But I was remiss in not acknowledging the great work of the communications team and with Kevin Sibley to really drive the incredible numbers for applications that our executive director reported on earlier. So I was remiss not highlighting the work that had already been done, but I was really suggesting that as a team, and commissioners included, that we had this 2-month extension that we could really push hard to get more folks involved. And I know Kevin has been doing that. So it's somewhat of an apology, but at the same time, I'm glad to hear that we're going to be kind of redoubling our efforts in this short amount of time we have for the SEP cohort application period being open, that we can focus on not only Lawrence, but some of the other communities. Commissioner Roy has highlighted some of those. There's some communities out in Western Mass that might have opportunities as well. And just keep up the hard work to get as many applications in and get as many people into the program this time around.
Thank you, Commissioner Stebbins. Commissioner Concepcion, please go ahead.
Thank you, Commissioner Camargo. Thank you so much. And you and Matt Giancola, it is evident, there's been a lot of work and effort put into this, and it's been great to hear from Lawrence. And just to hear where they're coming from and understanding what has happened along the way and what can possibly happen in the future. I've been on record time and time again now since March about the process that we have ongoing and making sure that we realize our equity mandate and the significance and importance of, any sort of changes to our list of areas that have been disproportionately impacted by the war on drugs. So I just want to thank you. It's telling, and I'm glad to hear that Lawrence is now being heard and they're at the table, and now we can have this included in our discussions going forward.
Thank you, Commissioner. So Commissioner Camargo, I don't have much to add beyond what your fellow commissioners have said, but I do want to just pile on a little bit. And first of all, thank you for your leadership and passion on this really important topic. And this is probably not a word that you would expect to hear from me, but thank you for your graciousness in this conversation. I really appreciate it.
Thank you, thank you, thank you. And I appreciate everyone comments on the passion, and I really appreciate that, but I really want to make it clear that these are facts and data, right? And I think that we're all passionate about this work, and want to make sure that that's very clear. So thank you, Chairman, and thank you for the kind words. Thank you. At this point, Commissioner Camargo, could I ask you please to repeat or make the motion, please? Absolutely. So I motion to table until the commission has collected sufficient data on Lawrence and public feedback on disproportionately impacted areas designated. In the meantime, we will continue to, do our outreach efforts to Lawrence and other identified towns. Thank you very much. Could I ask somebody to second that motion, please? Let the record show that the motion was made by Commissioner Camargo, seconded by Commissioner Concepcion. I could barely hear you that time, but I did see you move your lips. So thank you. Could I then please have your vote, please, Commissioner Camargo? Aye. Thank you, Commissioner Concepcion. Aye. Thank you. I heard that. Commissioner Roy. Aye. Thank you, Commissioner Stebbins.
Aye.
Thank you, Commissioner Hoffman. Aye. Let the record show the motion was approved by a vote of 5 in favor. Commissioners Camargo, Concepcion, Roy, Stebbins, and Hoffman with none opposed. Thank you very much. Matt, can we go to the next slide, please? I'm sorry, you're back now in your other role behind the camera. Before we get into upcoming meetings and adjournment, I am not aware of any topics of which I was not aware at the time the agenda was posted on Tuesday. Our next meeting is on November 18th, Thursday, November 18th. Again, it'll be remote via Microsoft Teams, and it will start at 10 a.m. For the astute members of our viewing public and my fellow commissioners, you will notice that there's not another slide right after this one that we usually have, which is upcoming meetings. We currently have the intent of not having a meeting in December, a public meeting in December. It's something that we've done in previous years. I think it is partly because of the holidays, obviously, but it's also, the staff works, as we've all acknowledged many times today and in previous meetings, staff works incredibly hard doing their day jobs, let alone the work that's involved in preparing for these meetings. And I think it's good to give everybody a little bit of a breather. So we obviously have the ability to have a special meeting in December if something comes up that requires our timely attention. But right now I wanted to announce that it is our intention not to have a regularly scheduled public meeting in December. We are currently starting to work on our 2022 calendar, again, through the good offices of Matt Giancola. I think he's reached out to each of the commissioners to try to make sure that we don't do anything that's in conflict with the previous plans that you might have. I've also asked Matt to help me avoid the embarrassment that has happened twice in my tenure of scheduling something on a Jewish holiday. I should know better, and I don't, but Matt's going to help me look good. So thank you for that in advance, Matt. There being no further business before the commission, can I ask please for a motion to adjourn?
So moved.
I think Commissioner Stebbins, you just barely won the race. Could I have a second, please?
Second.
Thank you. Let the record show that Commissioner Stebbins made the motion, seconded by Commissioner Camargo. Commissioner Camargo, your vote? Aye. Thank you. Commissioner Concepcion? Aye. Thank you. Commissioner Roy?
Aye.
Thank you. Commissioner Stebbins?
Aye.
Thank you. Commissioner Hoffman, aye. We are adjourned as of 2:54 p.m. On the 14th of October, 2021. To my fellow commissioners, thank you so much for your participation and collaboration on these matters. To staff, to Sean, thank you very much. And to everybody listening, please be safe. Thank you.
Thank you.
Thank you.
Thank you, Sean.